ਸਤਿ ਸ਼੍ਰੀ ਅਕਾਲ ਜੀ ਜੀ ਆਇਆਂ ਨੂੰ ਤੁਹਾਡਾ ਸਾਰਿਆਂ ਦਾ ਬਹੁਤ ਬਹੁਤ
Hello, welcome to the Icon Forum. And this Dr. Guljar Chima will be host of this program, and myself Prabhjot Kalo. My name is Prabhjot Kalo, and we hope you will get a very good good information from the experts.
Thank you.
Good morning to everyone. First of all, you came here to this program. Our program is intercultural online health work. The main heading of this is take charge of your health, living well together with diabetes. This program is especially for South Asian community. Before I talk further about this program, I wish to inform you that this ICON project, the office is in UBC, and that is also on traditional territory of Musqueam, Squamish, and Stalwart people. And I would also like to acknowledge that you are joining us today from many places. Online or in person, whichever territory you're participating from, and we acknowledge all those. And now Prabhjot will explain you further what we are doing next, and then I'll talk to you again.
Today's program, there are very special things about this program. There are very good program. We are providing this program in Panjabi. But you can also listen to this program in English. Anybody who wants to listen to this program in English, there is a special headsets, mics. You can just have to put the wire in, and then you can place the headset on your ears. And they already have set this up, so it's on channel 1. You don't have to do nothing. You only put the headsets on and attach the wire, and you can also listen to this program in English and as well as in Punjabi. And secondly, this health exhibition is especially you can see in the lunch break. There are community partners in this exhibition from ICON and the different community partners. There you can get very good resources regarding to your health. That will be around 12:15 to 1:15, and then after that you will be provided with a lunch. There will be a lunch, and there will be a question answer period. They will give you different information, all these different speakers, especially how you have to manage your diabetes, how you look after someone in the family who have diabetes, and if anything is linked with that, there are notepads in your bags, there are pens in your bags. You can ask questions. There will be a session, question answer session, and there will be one in the morning and then one in the evening. You can write a question anytime during the program, and then you can give it to our staff. You can write the question, and then we will ask those speakers after the session, and they will be able to answer all your questions. And people who are online in their homes, or they can also send us the questions. They have to go to the QA feature and then have to send it. And very important is your feedback, because there will be a survey of this program. And we have given you the bags, and there is this survey in the bag. You can fill up your survey and you provide us with the feedback, because there are community partners. Whatever your problems are with the health, they are delivering, whoever delivering these program, how we can improve this program, how we can reach you easily, how we can make a good approach. It's very important. Your opinions are very important to us. Please give us the feedback after the end of the program. And who are online for this firm, please also send us online your survey. There is an option on the side. If you need to go to the washroom, there are doors. These doors will be open. You can go to the washroom. When you get out, it's on your left, under the stairs, and there are some washrooms there. And if there is nearby close on the right hand side, if you get out through this door, there is a washroom on your right side. But try to make sure you don't disturb others. Our staff is here. If you have question, anything you want to ask, our staff is present here. You can let them know. Yes, Dr. Chima.
Now I'll tell you about the icon project in a couple minutes. Why do we have this name and what does it mean and who's in charge of this? This program, as you know from the name, it's Intercultural Online Health Network. It's with UBC Faculty of Medicine, Digital Emergency Medicine Collaboration. Under Dr. Kendall Ho, who's Dr. Medicine, and he's the head of this program we have designed for you. I'm medical director of South Asian program. This program its purpose is to assist multicultural and indigenous citizens, patients, and caregivers to optimize chronic disease prevention and self-management, to provide reliable and relevant health information to citizens, to promote communication between community members and health professionals. Ministry has been funding this for last 12 years. And we also want communication with you so we can have your input to make this program better. It's not that you don't want to talk to a doctor or not, to a nurse or not. You should share your information and your input. This is your right. And the more communication you have with your professionals or health professionals, better it is to improve your health. So that is the purpose of this program. So that you can talk to the professionals, you can do online as well, and you can approach them from anywhere in the world. We have good presenters here, you will see, and please talk to them and in your own language, and how to improve the communication between you guys.
As you listened to Dr. Chima, this icon program is provided to you by Ministry of Health BC. So regarding this program, this is from Ministry of Health BC, Senior Primary Care Advisor, Primary Care Division BC, Ministry of Health, Sherry Barr. We will listen to her message. Please play the video. Good morning. I am Sherry Barr, Senior Provincial Primary Healthcare Advisor in the Primary Care Division of the Ministry of Health. I work on Patients as Partners initiative. Thank you for the opportunity to provide opening remarks today at the health forum. Take charge of your health, living well together with diabetes. Please accept my apology for not being able to attend in person today. I wish that I could have been see all your smiling faces. And I would like to acknowledge and offer respect and my gratitude to Lekwungen people on whose traditional territory I am located, on the Songhees and Esquimalt people whose historical relationship with land continue to this day. I would like to acknowledge the chartered community local in Victoria. I'm very grateful as shelter to be on this beautiful land. Patients as partner motto is nothing about me without me. We believe that engaging patient and their families, healthcare providers, and community partners in healthcare is not only the right thing to do, but it is effective way to make the health system better and people of BC healthier. Patient as partners has collaborated and funded ICON over 10 years with Dr. Kendall Ho and as the executive director for all that time. ICON continues to do an exemplary job engaging communities and bringing healthcare providers together to speak with the people in their first language about the topics that people want to learn more about, including today's for diabetes is important health topic. According to BC guidelines and protocols 2011, diabetes care guidelines, on average over 32,000 people are diagnosed with diabetes every year in BC.
ਡਾਕਟਰ ਕੰਡਾ ਤੇ ਇਸ ਤੋਂ ਇਲਾਵਾ ਜਿਹੜਾ ਸਾਡਾ ਦੂਸਰੇ
Other than that, the second message we have is from Dr. Kendall Ho. He's a medical specialist in emergency medicine in UBC, and he's a professor and specialist, and he's head of UBC Faculty of Medicine, Department of Emergency Medicine, and leads the digital emergency medicine. So he is the main lead person to provide people these programs in their own language. Now let's listen to his message. Hello everyone, welcome to the ICON's South Asian Forum on Diabetes. I'm very excited to be here to welcome you. My name is Kendall Ho. I am the Executive Director of Intercultural Online Health Network of ICON and also Professor of Department of Emergency Medicine at UBC, Faculty of Medicine. I'm very excited to see many of you here. Many of you are old friends that have been on this journey with us together. And also many of you are new friends joining us. The whole point is for us to work together so that we can live well and healthy. I would like to first thank the Ministry of Health, Patients as Partners Division for supporting us in this ICON initiative. Also fantastic to the collaborating with the city of Surrey, and they have made their location available for us. Really appreciate that a lot. And also a great partner, and also with Fraser Health together. Fraser Health Authority to work together on this forum. Also would like to thank our health professional leadership. I would like to thank Harleen Chahan, and also with great support from Dr. Guljar Chima. And also we have a list of fantastic speakers that will be presenting on diabetes. You will get to meet them and hope that you will enjoy what they have to say to you. And most importantly, I hope that this information is helpful to you and your family members to live well. I like to thank you very much for being here. I would like to pass it back to the events coordinator so we can get things going. Again, thank you for so much. And also please visit all our partners with their booths. And also really appreciate all community partners and media partners to support this event together. Thank you very much.
Dr. Ho.
This was Dr. Ho. I'm pleased to announce that we have 8 specialist speakers. You already have enough knowledge for diabetes because Dr. Chima is always providing you some information on the TV and radio. But today, you will be able to listen to the expert speakers discussing many aspects of diabetes. They will show you in a different method. They will make you understand in a different. We are very thankful that we are in Canada and we have all these opportunities available in different language. So there will be 8 different speakers. They will provide you information in 2 different sessions. There are psychologists when because the hormones changes with diabetes, how the problems with your eyesight, with other problems with diabetes. They will share all kind of information. Now we are not going to waste your time too much. This is the time we have to bring our first speaker, Harvinder Gill. Harvinder Gill is a registered nurse. She finished her nursing degree from Kwantlen Polytechnic in 2006, and from last 12 years she is working as a diabetes educator nurse. Before that, she worked in a palliative care. She has experience with that, and she tried really hard so that she can educate in their own language our Punjabi about the diabetes and chronic diseases. She also revised the Punjabi version of a booklet. So yes, Harvinder, come and introduce yourself to the listeners. She will talk about the introduction to the diabetes and its complications.
Today, we know we'll talk about diabetes, and we're going to cover so many topics. First of all, what is diabetes, and how do we know that if we have diabetes or not? And what are the symptoms? We'll talk about that, and then we'll talk about, what the risk factors. Is it ethnicity or lifestyle, age, if that makes any difference, if we have diabetes or not, or if we will get diabetes or not. There are 4 types of diabetes, and we'll talk about those. And there are other diabetes as well, caused by medications and any other damage caused to the body. We'll talk about those too. We'll check our blood sugar at home before eating, after eating, how much it should be, what it should be, and A1C, what it should be, and to prevent the complications. And the doctor should know if we have type 1 or type 2, and there are different tests they can do if we have type 1 or type 2 diabetes. But in our culture, mostly it's type 2 diabetes, and how to look after your feet, and if you have diabetes, if you don't take care of it, and what are other dangers that we can face. We'll talk about those. And exercise, why is it important, and how much. We'll talk about that as well. What is diabetes? Before understanding this, we should understand what happens to our body. If our body is working regularly as it should, or when we have diabetes, how different that is. You can see we have organs, we have pancreas, and diabetes, when the pancreas create insulin, and it's like a key. Without that key, the sugar cannot really get dissolved in the body. So that is the key, and to use that key, and it goes into your kidneys, it goes through your body to use as power for your body, and it's stored. When you have the diabetes, and what diabetes it is, we'll talk about that later. But the main function is pancreas, insulin is not making insulin, or it is not working well, or not getting dissolved. So what are the symptoms of diabetes? Type 2 diabetes, then we know what the diabetes is. But the type 2 diabetes, sometime up to 60 years old, we don't know, because sometimes there are no symptoms. So according to the Diabetes Canada guideline, in few years, and we don't know until we get the complications. So do the blood testing. It's really important to get it done. Talk to your doctor about that. You can get it done. We'll talk about that later. But if we know if we have the diabetes or not, if we are urinating frequently, not hungry, or feeling hungry even after eating regularly, feeling thirsty, and blurry vision, and cuts are slow to heal, and weight loss as well. We eat regularly and everything, but still our weight is going down, or numbness in our hands, feet. These are the symptoms of diabetes. But type 1 diabetes type 2 diabetes, as I said, that happens. There are so many patients I have, and they just went for an insurance test, and then they realize they have diabetes. So it's really important to get your blood work done, to testing done to see if you have diabetes or not, if you have symptoms or not. And if we don't really look after diabetes, what can happen to us? There are so many problems. We can have strokes, and it can affect your brain. It can affect your eyes. Then we might have to get some injections done in our eyes. So if we don't care about the health, blood circulation problems, and a lot of time our kidneys get damaged as well. And sometimes we have to go to dialysis for that. And the feet problem is quite higher in these patients, get infected, and sometimes you have to get amputated. So you really have to look after your feet. You can prevent all those complications. And even if it is a minor injury, it can cause big problems if we really don't take care of it. And last thing is neuropathy, and it's hard to explain in Punjabi. It's like, putting your hand on a stove, and if it is hot, you remove your hand right away. So your nerves get damaged, and that controls your body as it should. So it can cause nerve problems as well. But if you're drinking and we have diabetes, it can damage it further. So we'll talk about the nerves as well, because if we are unable to digest our food, and we can have those problems as well due to diabetes. It's really important to control the diabetes as much as possible so that we don't have those problems.
What are the risk factors that we get diabetes? If we are in a Punjabi family, it's like stigma that we are going to have diabetes. For example, South Asian, South African, the number is high in this population. If we weigh more as compared to our height, and if we have belly, if we have our parents, our grandparents, they have diabetes, we get diabetes probably. And the age factor, and then if we are above 40, there are chances. The type 1 diabetes is usually in the children. But we also notice, if you are up to 20, then it could happen. Ladder type, like that's present in the older population. Usually, for type 2 diabetes, if we are above 40, then there are chances you will get type 2 diabetes. Hypertension, high blood pressure, high cholesterol, not healthy diet, or if you have a sedentary lifestyle, you are not active enough, you are not exercising, and you are in stress. Stress is one of the reasons that will cause diabetes. So we talked about types of diabetes, but there are two types of diabetes, type 1 and type 2. You can see in the picture. The healthy pancreas creates insulin, and then the body takes insulin from that. It gets absorbed in our body and different organs. In type 1, the pancreas completely stops and it doesn't make any insulin. So there is no insulin in the body, and then there is more blood sugar in the blood, and because the pancreas is not working, then you have to have shots. There is no other treatment except the shots. Exercise helps, but mainly the treatment is the shots. So type 2 diabetes, for type 2 diabetes, in that case, the pancreas is creating insulin, but slowly, gradually it decreases. It's like the key is, but then it cannot work as a key. So if there is a belly, if we are not exercising, then there will be high blood sugar in the blood. The secondly, gestational diabetes. The gestational diabetes is during pregnancy. That's temporary. Usually 60% of women they get type 2 diabetes later on in their life. So if it's very important then to take control of it. Pre-diabetes is that we have a chance now that there are chances we're going to get it, but we don't have it yet, but there are chances. So we can correct our diet, we can exercise, we can correct it. There is diabetes that's not chronic, it's a temporary condition. Sometimes there are medications, some therapies. Sometimes our blood sugar is more. Sometimes. Mainly there is type 1 and type 2, gestational. These are the main kind of diabetes. So when we have diabetes, you can see on the screen people who already have diabetes. This is for them. People who don't have diabetes, their targets are different. It's not for them today. This is mostly for people who have diabetes. When we check our diabetes, our blood sugar at home, before eating, before the meals, we do check. Yeah. Then our blood sugar is all right. We know that it's gonna be up after the meal. Then we see how much is up. Then we get stressed. So we should check before the meals and after the meals. So the doctor will tell us how many times you have to check your blood sugar. So before meals, your blood sugar should be 4 to 7. But if you have to measure like the Indian way, then you have to multiply these numbers by 18. So 2 hours after a meal, you should check your blood sugar again, and that should be 5 to 10. But we have to see how much it was before and how much after the meal. So how many points is up? If before meal is 7 and then after meal is 10, then it's okay. It should be only around 2 to 3 points up. If it's before meal 4 and then after meal 10, then it's a big jump. Then we have to really look around what we eat. So do we need medication? Do we need exercise? Or do we need to change our diet? Second test is every 3 months. You can, if no fasting required, you can go do anytime. That's called A1C. What do they do during A1C? How much blood sugar is attached to our red cells? So every 3 months they check your red blood cells, because how much sugar is attached to the red blood cells. But home testing has different numbers. A1C is different numbers. So we have to keep it 7%, under 7%. If it's more than 7%, there will be complication with the diabetes, and the chances are more for complications. If we get the diagnosis, if we want to get the diagnosis, type 1, is this type 1 or type 2, is usually with the blood test check. But there are other tests that you have to do, GARA-65, to confirm if we have type 1 or type 2. Most of the time we know right away which is a type 1 or type 2, but there are times when that it could be type 2 or type 1. Then we have to go for further testing, that is it type 1 or type 2. So if you don't know your diagnosis, you talk to your doctor and you go for blood test and you confirm with more further testing. So every 3 months, please check your A1C.
So
Now we'll take some more time to talk about foot care. As we say, that if you have eyes, you can see. But if you don't have feet, you cannot walk if you have problems. So these are regular things you can do. But if you don't take care of your feet, you cannot work, you cannot walk. So it's really important to take care of your feet. First of all, we should wash our feet daily very well and dry it, especially between toes. So between your toes, make sure you wash and clean and dry. And feel your feet for bumps or temperature changes. And if you cannot see underneath, you can use mirrors, and it's really important to check underneath as well. And if you want to use any lotions or anything, we can use it, but don't use lotion between the toes. And if you have many dry cracks and chapped heels, you can use that. Then you can use special creams. Then the dry, you can peel off the dry cracked skin. But if there's any each bumps or anything or any injuries, we should make sure that we don't peel it off, because that can cause infections. So when you're checking your feet, if there's a redness or swelling, and if there's any leakage, and then it's been going on for a week or 2 weeks and it's not getting well, then get it checked from the doctor. And when you have diabetes, you should get your feet checked at least once a year. And when the doctors are checking feet, they're making sure, and they do all the testing, and they will check underneath and on the top of the feet as well. If you can feel it or not, they're going to check the color as well. And they're also going to check if they have any swelling or any different shapes. And when you're wearing your shoes, make sure you clean your shoes. And one patient told me, and they said, I usually put my keys in my shoes, and somebody needed a key, and they took the key, and they didn't know. And they didn't know the key was in the shoe. And that caused some injury to the feet. And then, it was leaking. So we need to make sure, sometimes we don't know what's underneath our feet. So when we're buying our shoes, make sure, when you're trying new shoes, try it in the afternoon. So if there's any swelling or anything that can happen, and especially the toe, the biggest toe on the side, and it should have 1 centimeter gap between your big toe and the front of the toe of the shoe. And if you have socks, and if there's any marking or anything when you take your socks off, then it's too tight. So we should wear socks that keeps our feet comfortable, and then your feet are not ventilating well. If you have socks and then tight shoes, you're restricting it. So make sure you use good socks, good shoes. We take it off, and we should check our socks to make sure there's no discharge on it. So you should always look after feet as much as possible. And it's also very important to control our sugar levels. You can take care of feet, but if you don't control your sugar, then we cannot reduce the risk that you can face further in life. So it's very important to take care of your feet.
So also remember, if you have a little or small injury, it could get into a big injury. It could be a big wound. So it's very important to keep it. So write a note. If you have a problem with your feet, then talk to your doctor. So in the end, we will talk about exercise, physical activity. So usually when it's summer, we are very active, we walk, we do exercise. But when it's winter, we always stay inside, right? So it's very important to exercise for cardio, like our heartbeat, at least half an hour every day. If not every day, every other day. So our body gets back to normal if we. So we should do it every day, at least half an hour. After the meals, don't talk empty stomach because our blood sugar can go up. So we after the meal, so that the blood sugar that came from our food should be used. So there is another exercise that's called a resistant exercise, like belts, like weights, just to lift up your body. So at least try to do it 3 times per week. Lastly, stretching. So whenever we exercise, we should also do some stretching. We need it as well. So we should do it 3 times per week at least. If we are above 40 years of age and we never exercised in the life, not walking or we don't walk, so talk to your doctor at least, so that we make sure we are good to run or not, or good to walk or not. So if you have heart disease or some other thing, please talk to your doctor, consult your doctor, so that he can advise you what kind of exercise is good for you. These are our sources. Then Harleen will tell you later on what kind of resources we have, and during lunch also. So whatever materials I used for the information, you can get them. Thank you. Welcome.
Thank you so much, Harvinder.
Thank you so much, Harvinder. You have provided very good information. For me, there were some new information for myself. There were information about diabetes and foot. So you will be able to know many good things today. So whatever notepads you have, please write your questions. Our staff is here. You can give it to them. So people who are watching online this program, they go to Q&A function, and any kind of question they have, they can just put it online, and we will answer those questions in the question answer session. So our next speaker is a well-known Dr. Guljar Chima. You also met him, listen to him. They are providing us this very good information for a long time. He is a health expert. He is also a politician. So he is also a minister of mental health issues. He was elected in the Surrey Panorama riding. They are also a professor. He is also teaching. He is also a community worker. They will be sharing some information that's very special, how you can increase your life. You can have more information from him here, Dr. Chima.
Thank you, Prabjot, and welcome everyone. And I want to talk about a lot of things, but in next 10-15 minutes I'll try to explain to you in simple language about diabetes. And first of all, nurse practitioner explained it to you very well, because the issue is we all think about, and we also think, it's always duty of our primary doctor and all the people who are here, and they're equally important to everyone. So I think if you think about everybody and you listen to everybody what they have to say, and then you can teach others. I want to talk to you about the diabetes, building your knowledge about diabetes. How diabetes affect more than just your sugar, and what part of your body is damaged, and so many things that you don't know earlier, and what are the reasons. I'll focus on type 2 diabetes. And what is type 2? How does it affect? And insulin doesn't work. And out of those reasons, I'll talk about those reasons. So those are most important. Most important, the machine. Pancreas is the main machine to control your sugar level. And it doesn't create insulin and doesn't get dissolved further up. And it's going to damage our body further. And you cannot function well without sugar as well. So it's very important. But it's also important not to have too much glucose or too much sugar in your body. And the main reason is increasing weight. We were all fit, and they were all working hard. And people were, when they were working hard, they were able to control your weight. And they used to say, if you're not heavy, that means you're not getting enough food. So the fat that's attached to your tummy, you should control that. It's very important to control that. And the second is stress level. Everybody thinks we belong to this community, we have the stress so much, we got it, we cannot change it. But we can change the stress level. And our stress level also goes up. That you should also check your blood sugar levels, because it affects, the stress affects, and the medicine also affects. When the doctors, we give you medicine, and when you're taking the medication, and every medication has different side effect. There are so many medications, they increase your blood sugar level. But I want to make sure that you should keep this in your mind. There's some good medication and some bad medication and how it affects. So ask your pharmacist. And people who have long-lasting asthma problem, and doctor has prescribed you some medication, and your sugar level will go up because of that. So you should monitor that as well. And I know some people won't like this. Our diet is very important, and that has ruined our life. And our body has not changed, but our diet has changed. We are using diet against our own body. We eat too much, we are eating too often, and we are eating excessively. And all our food, our sweet shops, wherever you go to, any function or program you go to, like any festivities, Diwali, any temples, gurdwaras you go to, and we are wasting our own body with our own money. It's very important. We don't really think about it, and that the cultural problem we have, we need to change that. And first, people 40, 50 years old, and the people are thinking we are gone, it's our time to go. Now people are living up to 90, 95. I'm 68, and I'm totally fit. I'm not saying I'm going to leave in 5 years, but if you control your diabetes, it's really important to control your activities. It's very important.
Lifestyle is very important. How you eat, how you drink, what you eat, what you drink. Most people think the one drink is not going to make difference, but what about other things you add to it? For if anybody has any suspicion You can see Health Canada guide. They set new guidelines before 7 to 8, but now they said no, less than that. Please bring the next slide. These are little small things, but they make a difference. I want you to understand, when you have diabetes, it's gonna damage your body from your nails up to your head. It will affect everything, and it will affect adversely, not a good effects. How you will get heart problems. When you have diabetes, you will have cholesterol problem. There will be less activity. It will stress your heart. If when you will have, it's not only heart problem. When you have heart problem, your whole body will be affected. So it will impact the whole body. For example, kidneys. It's very important about talking about kidneys. It's not a little thing. You will say, oh, it's not much, it's just little bit protein leaking in your urine. When the protein is leaking in your urine, then you should be careful. Should be a red flag. You should go to your doctor, to your primary doctor, that your kidneys are leaking protein. You should be watching. So your kidney function, for example, you should be told your kidney function is impacted. You say, okay, I'll go home, I'll talk to my family, but you should get your kidney function checked every 3 months. You should be monitoring your kidney function so that you can prevent it for the damage for a long time. You can go to any renal dialysis clinic. Your eyes will be opened, because you can see, you can focus, as I explained earlier. Wherever your blood sugar will go, it will affect your organs. It will affect every organ, every way. And it will also affect their personal life. How it happened, how did it happen? But it takes long time to happen. Diabetes also affect your vision. The eye doctor will explain about the effects, but unfortunately, it's not only the family doctor's work. It's your responsibility as well. It's not only the responsibility of the family physician. When it starts, it will affect the vision, and your eyesight could go in a long time. Please go for the next slide. So I can tell you in 10 minutes how you can start from the brain. So we will start from the brain. Stroke. Your memory is gone or affected. It all because of blood sugar. There is no second option. It's all because of your blood sugar. Check your eyesight all the time, because it will affect your eyesight as well. Kidneys. It will damage permanently to your kidney. So in community, you can see people are facing problems because they couldn't handle these things properly. How about diabetic foot? So it is explained to you earlier very nicely that there is numbness, there is pain, my shoe was not correct. So buy good shoes for your health. It's very important. Next step is, next slide please. It's very important to keep your weight maintained. Normal body weight is very important. So we are having 2000 calories worth food, and if you walk, maybe you are spending 50 calories. You have to control your portions. You have to control your portion. So you should be controlling your serving, less food. 50 years earlier, you are sitting here, all of them. We are coming from the same households. So eat as needed. So you go home, you, so you eat food, and you eat it 3-4 times. Sometimes same problem on the parties. You have to control your serving. Same thing in the households. So if you are offering them more food, it's very important to talk about these things when we go home, eat, to visit someone, you say hello, and then it's very important to control your weight.
It's very important to have the weight under 100 kg. 80 is best. And the body mass index, we should have. Our body shape is different, the frame is different, and it affects your body differently. It's very important to control that and to walk. And I know a lot of people don't walk. There are only few people say I get tired, I cannot go. But please at least walk 4 or 5 times a week, 120, 150 minutes. Not doing anything at home. Go outside, move your body, become active. Exercise is really important. And also have some exercise that you can do for muscle resistance. If you have problem, you cannot go to gym, walk, take somebody, ask somebody to take you there, just walk. And there's so many parks in Surrey. It's very important to walk. And it's also really important to take medication regularly. Gurvinder will explain it to you later, but it has expanded so much. Ask them questions, and they will explain it to you. And I just want to tell you the medicine. Some people, they get medication prescribed, but they actually don't get the medication. And sometimes they cannot phone or they cannot order it. So it's really important to take the medication as prescribed. I have already talked about the complications. Until your hemoglobin A1C is not consistent, it should be below 7 for years. If it is not, then you'll have complications, and it will continue to create complications for you. And you need to check it every 3 months, not 6 months or a year. Stroke or heart attack, it will create all those problems. So if you don't control and prevent the complications of diabetes, it's very important, as I explained to you. First of all, hemoglobin A1C, it should be below 7. And it should be consistently below 7. And especially the blood pressure now. And you also know. And how many times you have asked your doctor what's your blood pressure, and they said fine, or you said fine, and goodbye. And ask them if it is between 120-80, and control your cholesterol, and ask them the reading, and what's the highest, what's the lowest, and where should I be, and where am I. Ask them, learn the vocabulary, ask the questions. A1C should be that much. And you should know about kidney functions, get the eyes checked. And if you don't check all those things, you are damaging your own health. And I want to talk to you about medicine. Not much, but just a little bit. But we do have pharmacists who are very capable, and they will explain it to you. There are different medications. And there was a time when metmorphin was the only one available. And then there are third, fourth, and other medications. Every medication has different mode of action. And it's your doctor's duty to inform you. And we have doctors who will explain it to you better. And it should be based on your age, based on your exercise, based on your need. You should take that medication. Fortunately in BC, there are so many different medications that Ministry of Health has approved, and they have expanded that. and we are all benefiting from it. I am diabetic myself. And how do I manage it? Which medications are covered, which are not covered? The medication that is covered, which is fine for you, doesn't matter how expensive it is. It's not more expensive than your own health, your kidneys. Even if you save $50 a month, you cannot save yourself. The check or the money you receive, it's for your medication. So try different medications if you need to. And if you need to take a medication, take it. Doesn't matter how expensive. And ask the pharmacist, how do you get it, how it's made. 400 million people in the world has diabetes in the world. And there's different sort of research being done on this. And increase your knowledge about this issue. And talk to your doctors, talk to others, pharmacists, 4 times. And see a doctor at least 4 times a year about your diabetes. And this is my weight, this is my height, and this is my hemoglobin A1C, and what side effects this medication has. And after doing all that, and when you go back 5 months, don't mess up all that. And follow up the same recommendations even if you're out of country. And don't think, it works in Canada, not in India or anywhere else. So take the medication. Make sure you take the medication. It's very important. And, the approach is very important, that how to control your diabetes and how to save yourself from diabetes and how to take care of your health and how to survive, and economically how it is better for your body and your health. And if you go to the doctor and sometime you don't learn that, and what are you going to do in 2 or 4 minutes? Your relatives are waiting outside, and this all impacts your health. And our purpose is to explain it to you. And we've been doing this program for the last 12 years. I'm tired of doing all these programs every 4 months or every month. We are doing this, and please take care of your health and pay bit more attention. And this is our body, it's going to go with us. And which organ are you going to save, which organ you need, you should look after all those. And keep your health, your body healthy. And we are living in a good place, a good environment. Health services are the best. And use them effectively. And I'm talking to you, think about it. And I have done these programs many times. But please pay attention to your health. And don't rely on anybody else. You are only responsible for your health, no one else. And we can do only a few things. Thank you very much.
Thank you so much, Dr. Chima. You did practical discussions. What is more important in life, what we should give more importance to. So we listen to very good discussion. So please note, please write. Our staff is present here. Please write your questions, any suspicions, any questions. Please don't hesitate. You have specialists here, so please ask them. They are here in person. Any doubt, any concern, any question, please write it down and provide it to our staff. Our next speaker is Dr. Jagjit Kaur Padda. She is endocrinologist, means hormone doctor. So what changes in your body come, how they are related, these changes, how these changes are related to the diabetes. So Dr. Padda was born in Victoria, and she completed her training in USA. She is a doctor of hormones and metabolism. You already heard her many times on the radio and television. She is just like Dr. Chima, providing information on the media. So to our community, she is educating our community as much as she can. She is now working in Abbotsford and Surrey. So she will share some information with you how diabetes how diabetes is linked to heart and kidney disease. Dr. Padda, please. Thank you, Prabjot. Hello, everyone. Welcome. Today, as Prabjot told, we will talk about diabetes, the link between diabetes, heart disease, and kidneys. Today's topics are heart disease and stroke and heart attack and how they are linked to diabetes, and as well we will talk about what can you do so that the risk factors are reduced. So first we will talk about diabetes and heart disease. Diabetes, how is linked diabetes and heart disease. Heart disease is the biggest cause of death amongst patients with diabetes. Diabetes and heart disease they are equally bad. People who have diabetes, type 2 diabetes, patient with type 2 diabetes without prior heart attack found to be at the same risk for heart attack as patients without diabetes who had a prior heart attack. So there is a famous study that's very much important. Birmingham Heart Study found that the presence of diabetes increased risk for cardiovascular disease by 2 times in men and by 3 times in women as compared to the general public. Compared to non-diabetics, diabetics have higher incidence of multi-vessel disease. So that's why we have to control our blood glucose so to prevent the complications of diabetes, as Dr. Chima also talked about that. So it's very important to control your blood glucose levels. If your blood sugar is up, then there will be more blood vessels that will be affected. So the diabetes could cause heart failure because the blood cannot flow properly. So from the heart, it cannot flow properly. It's called congested heart failure. So the blood vessels, the walls of blood vessels, there are walls to the blood vessels. So the platelet activation leads to platelet aggression is present in your blood, and they all collect where the wound is, and that way they can plug the arteries, and that way the blood is not going to reach properly adequately to your heart. So we also know that if your sugar is up and it's always up, then there will be more wounds on the walls of the blood vessels. Then you can see this in the photo on your left, how the cholesterol plaque is deposited in your blood vessels. That's how they get plugged, because there is a plaque, cholesterol plaque, and then the blood cannot flow adequately to different organs of your body. So in the next photo, you can see how these are the things that can affect your heart: high cholesterol, high blood sugar. All these things affect your blood of your heart. Then we will talk about diabetes, stroke, and heart disease. So how they are linked all together.
So diabetes, stroke, and heart disease can increase the risk, and so some diabetes there causes other problems as well, and they can cause these problems. And with those risk factors, it can close or plug your arteries, and your blood is not flowing well. And then we talk about diabetes and kidney disease, and how does diabetes affect your kidneys. And first of all, when you have the kidney disease and diabetes, there are no symptoms early on. And I see many patients, when I tell them, there's a symptoms of kidney problems, that tells me, diabetes is affecting your kidney. And then they say, oh, I'm not feeling anything, I'm fine. But first of all, you don't realize it. But after a while, when the problem gets worse, then you get the symptoms. It's very important to diagnose it earlier and control the diabetes so it does not affect your kidneys. A kidney has some functions. What does it do? Kidney filter blood, remove waste and products along with water. So it's very important. It's removing the waste products out of your body. So it's very important to protect your kidneys from the effects of diabetes. And other speakers have also talked about this. Diabetic kidney disease can affect you so much that you might have to get the kidney transplant done. And they have to do the surgery, or they have to send you to dialysis. And if your kidneys are diseased, it can increase risk of heart attack and heart failure. And high glucose levels in the blood can, as I said earlier, can cause blood vessels to become clogged and narrow, resulting in lack of blood flow, which leads to kidney damage. Because blood is not flowing to kidneys well. And nerve damage can lead to miscommunication between the brain and the bladder, leading to the brain's inability to differentiate between an empty and full bladder, and it cannot tell that it's empty or full. The pressure from a full bladder causes kidney damage and can cause a lot of damage to the kidneys. So it's very important to control sugar and blood. It's also important to control blood pressure as well. You can prevent diabetes to affect your kidney. High blood sugar and high blood pressure both damage blood vessels and organs as well. Talk to your doctor about diabetes medication that can work to prevent complications in conjunction with good glycemia control. And it also can help you get your body better. And how is diabetes linked to progression of kidney disease? Physicians will order protein levels, known as albumin, in the urine along with blood tests to evaluate the level of kidney function. So it's recommended to have urine tests done annually. And they also do the blood test too. And it should be done based on your kidney functions at least once a year, maybe more. But you need to talk to your doctor what's right for you. And you can see in this photo, and on the left you can see there are healthy kidneys and the urine is passing fine. And on the right you see how diabetic kidney affects your protein leaking into your urine. Protein is important to retain in your body, But if the protein is leaking in your urine, it's a bad sign. And a lot of speakers will cover this thing today. As we said earlier, exercise, it's very important. And along with exercises, yoga, or any meditation, or to control your stress levels as well, because stress can also increase your blood sugar levels. And also monitor your blood glucose levels, and your doctor can diagnose which medication is better for you. If your sugar levels are going up before meals, after meals, and then they can adjust your medication based on that. And as we talked about it today, and we will talk about this more, it's very important to have a balanced diet, and especially carbohydrates. And it's very important to count those and how many carbohydrates you're going to take in your body during the meals, and how
the doctor that who prescribed you this medication is very important. It's very important to take that medication. After 3 months, you should go get your medication again reviewed, so they can give you more ideas. If it's expensive, they can give you an alternative medication, or they can give you good advice. Don't stop taking medications or adjusting your medication. Talk to your doctor. They can give you another medication, or maybe with less side effects, or maybe less expensive, so they can always prescribe you an alternative. What we can do so that we can control our diabetes. So tips for the home management and prevention. So high blood pressure, it's very important to control that, especially the diabetic patient. So we want their blood pressure, the upper blood pressure should be less than 130, and the lower one less than 80. So you can also talk to your doctor. If there are other illnesses, you can adjust accordingly. But diabetic patient, it should be less than 130 and less than 80, and the blood sugar level. If your doctor is testing, there are 4 kind of cholesterol results. We focus on LDL cholesterol. That's the bad cholesterol, like bad cholesterol. So we want it less than number 2. So if you already have heart attack, if you have heart disease, then we want it less than 1.8. And if you have any questions, you can always talk to your doctor which number is good for you. Generally, if you have any heart problem, it should be less than 2. So it should be checked once at least in a year with fasting. And another, control your weight. So it's very important to control your weight. There is a measure, we call it body mass index. So your body mass index is according your body and height. They can calculate it and they can tell you what it is for you. It should be between 18.5 to 24.9. As we talked earlier, Dr. Chima, A1C, this is the average for 3 months. So it's very important to know how much is your A1C, how are your results, because these are the results of your 3-month blood sugar level. It may be, if you are elderly, then if you are above 80-year-old, there could be little bit adjustment made. You can talk to that about you can talk to your doctor about that. If you are under 60, it's very important. How we can keep it? When you check your sugar during fasting, it should be 4 to 7. After 2 hours having your meal, it should be between 8 to 10. As Harvinder told you earlier, before, it's very important to keep your foot examined. As we talked earlier, taking medications, whatever medications are prescribed for you, you should be taking them. You can talk to your pharmacist. There are so many medications, how they can prepare a blister pack. With the blister pack, it's easy to take your medications, what time, what day, it's all arranged on your blister packs. So it is very easier to take your medications when you have a blister pack. So you can put it in your phone, you can set alarm on your phone. If you it will be easy to remember what time you are supposed to take your medication. So you can keep some medication in your purse, you can keep some at home, you can keep it along with you when you are going out. So change your diet, it's very important. And also exercising actively, going to the gym. The recommendations generally are that you do 150 minutes to 200 minutes to dedicate to exercise for 5 days. You should set that level. So 15 minutes in the morning, 15 minutes in the evening. Walking is a very good exercise. If somebody is smoking, so please quit smoking, it's very important. And sodium, so reduce sodium intake for blood pressure. You can talk to your doctor about that. Sometimes people have less sodium in their body, so it's not. So if you reduce sodium, it will be helpful to lower your blood pressure. So please check with your doctor and do your blood testing every 3 to 6 months. It's very important, whatever direction your doctor gave to you. So today you can see we have speakers today. Some patients say that I don't want to see my doctor, I don't want to see the nurse, I don't want to see the dietitian, I don't want to see the eye doctor. But you see today how important components, how important this team is, how they can manage your diabetes in a very good way. So there are some medications that those are initially that are used to control the blood pressure, but the research has shown that also protects the kidney, and they can protect kidneys from diabetes. We also got to know that people who have normal blood pressure, if these medications are given to those patients, they have the benefit to their kidneys. You can talk to this about your doctor. Even cholesterol medication also helps to those medications whose cholesterol is really good. They protected the risk, they lowered the risk, those medications, even to those patients who doesn't have cholesterol. So you can also talk to your family doctor. If you are above 40 years of age, you can take cholesterol medication. It reduces the risk of heart attack. So
ਨਾਲ ਸਭ ਤੋਂ ਵਧੀਆ ਹੁੰਦੀ ਹੈਗੀ ਆ। ਬਾਕੀ ਤੁਸੀਂ ਦੇਖ ਸਕਦੇ ਹੈਗੇ ਆ ਰਿਸੋਰਸਿਸ ਹੈਗੇ ਆ। ਤੁਸੀਂ 811 ਨੂੰ ਫੋਨ ਕਰਕੇ ਪੰਜਾਬੀ ਦੇ ਵਿੱਚ 24 ਘੰਟੇ 7 ਦਿਨ ਇਨਫੋਰਮੇਸ਼ਨ ਲੈ ਸਕਦੇ ਹੈਗੇ ਆ। ਤਾਂ ਹੋਰ ਵੀ ਰਿਸੋਰਸਿਸ ਹੈਗੇ ਆ ਜਿਹਦੇ ਬਾਰੇ ਆਪਾਂ
and we'll talk about those, and there are so many references that I'll provide to you, and thank you very much.
thank you so much, Dr. Padda, because all these speakers you have listened to, then at the end of the day, a diabetic patient, then you should talk to everyone. All healthcare professionals are important. They will provide you some health information. So our next speaker is
Our next speaker is Harleen Chauhan. She's the community engagement officer for Optimizing Self-Management and Family Sport. And I have to do my own work as well, but we have somebody else helping us. And she's very qualified. As you see, she got a long qualification list, and you listen to her. And she's Doctor of Pharmacy at the University of British Columbia in 2020 and completed a clinic pharmacy residency in Lower Mainland. And she has been working and cooperating with us, and we are very happy to introduce that she's helping us and she's moving forward. And now I welcome Harleen Chauhan to provide her presentation and explain what else we can do and what other services are available. Good morning. Welcome, everyone. My name is Harleen Chauhan. I'm clinical pharmacist, but today my role is to tell you something else and focus your attention to something else. My presentation today is optimizing self-management and family support. We have so many speakers, they're talking about so many different things. But I also wish to explain there are so many resources, and our healthcare system is changing. And how do we change ourselves and improve our health based on that? First of all, we'll talk about digital health. You must have seen that our health system has changed so much. There's so much stuff available online. You might have heard of digital health. If you can check your lab results online, and please raise your hand. Some people know about Health Gateway, where they can review their health results, and you can using digital health. And if you have used your phone to track your physical activity or how many steps you've taken and how much time you spent sitting and how much exercise you did, and the conditions and different heartbeat goes up or down, you can track that. And if you have used internet about what is diabetes, and that is also called digital health. We are using so much digital health. Digital health is very important for us. I know sometimes we are tired and we don't see, and why do we use the computer? Why should we use it? We can go to our doctor. But I wish to tell you today, there are so many services are now available on digital health, even access to your doctor. There are so many different patients, they can know how to use digital health. But we know in our community there's a big gap that we don't use the technology that much because we are scared that what are we linking to, what are we doing. People who are watching presentation and it's asking me to open an app, is it safe? And I'm working using this app, and it's a really big issue in our community. How can I use digital health and not? And there's so many different things that you might have used digital health. If you have used internet, you done any FaceTime, family members, and you have looked online. If you don't know how to make something, you looked at a recipe online, or you did some online banking. Internet is changing everything these days. So how can digital tools help me manage my health? If your blood pressure's gone up, how can you use digital health to your advantage? And how many people have computer or tablets at home or smartphone? Can you show me, can you raise your hand and show it to me? And how many times have you used it for your health? There's so many people who did. Now I want to explain a little bit more to you and how you can use it. We talked about lab results, and I'm really happy that people have used it. You can even see your doctor over the phone. You can make your appointments or track your appointments, and you need your video call. And as you said, doing your exercise, you can track it on your phone. And if you have Apple phone, eHealth or My Health, you can write anything there. If you have Android phone, Samsung, it has a health app. You can enter everything there. Why do we use digital health? First of all, it saves so much time. We go to doctor's office so many times, hospital, we have to wait so much long. But with digital health, you can see your doctor from home. You don't need to go there if your doctor is far away. And sometimes family doctor is not available or you don't have a family doctor. You can see a family doctor online and rest. And if you are sitting at home as we talk today, if you have any problem that's just starting, you have cut or any other issues, and you think you need to see a doctor, you don't need to wait. And if you're thinking you're getting doctor's appointment for 5-6 weeks away, and you want to see your doctor right away, you can access it through digital health. It's easily accessible, and we all have smartphones, computers. You can use all those. And sometimes, some patients are immunocompromised, like cancer patients. They could have health risk. If they go to hospital, they could face other problems. So with digital health, they can safely visit and see a doctor. And what can be done through digital health about diabetes? And we can monitor our medication on the phone. If you go outside and all of a sudden you need to go to the hospital or the doctor, if you have all your medication list on your phone, what medication you're taking, what dose are you taking, how many times you're taking in a day, if you have all that list there, you can easily access it and show it to the hospital. And you can go to your doctor, show it to your doctor, to pharmacist, even if you're traveling, like going to India. And if you lose your medication, if you have the list, and if you have that list on you, you can get those medications. And sometimes the doctors say to you, and other experts, to you monitor your blood pressure. You can monitor your blood sugar levels. You can use that on the phone. What was your sugar level before eating? What was it afterward? How much it increased? You can continue all that. And you did 1 or 2 days readings. And you went to the doctor or physician, so you can take it to the physician. Or if you don't take it to the practitioner, they don't know what your readings are. If you have it on your phone, the record on your phone, you can show it to them. And this is my 4-week record, and this was my sugar levels. And you can see it yourself. And morning sugar is fine. Some people say that afternoon sugar is fine, but my evening sugar goes up. Then they know what medication they need to change, what dose they need to change. It's very helpful, and you can use that all through the phone. And if you're getting health appointments, you can put it in your calendar so it can remind you. You can create reminders for that to go to an appointment. And you can also get your health records. And so many times I get this question: if I go to the hospital and saw my doctor or the pharmacist, how do I get my health record? Same place where you see your lab results, you can also get information about your medical appointments. And there's so many reports coming there as well. If you're going to ultrasound and you're getting something else checked, and they have all those. And if they have phone there, you can get all that information there. And there's one more thing. Health services, you have all those. You have an app, BC Health Navigator app.
You can put your location in there and you can see it. It will show you everything. All the it can also tell you about the wait at the emergency, how long it will take you if you go to the emergency. You can use that app with it's all on your phone. You can, if you are not here, you can listen to us at home, all those things. So today I'm gonna talk something specific is called Zoom. I want to talk about Zoom. So our healthcare provider, they are doing team meetings. They are on Zoom. Sometimes we have a question how we can choose Zoom at home. What is Zoom? Zoom is an application, very simple. You can make a video call. You can see them. You can listen to them. You can use it for family members. It's usually the healthcare providers are using Zoom. There are other things, see me, but if we learn with the example of Zoom, the main idea of Zoom is you can apply it to any platform. So we will use the example of Zoom today. So what you need for Zoom? For any app, Zoom is an application. You need a phone, smartphone, or tablet, or laptop. And you need an internet connection, and you need internet browser. What is internet browser? Like Safari, Internet Explorer, Google Chrome, Microsoft Edge. These are all the internet browsers. You can click this app, you type, that will connect it to the internet, and then you need a secure internet connection. It's very important if you want to make health visits. Some things you can connect with public Wi-Fi. If you have a healthcare appointment and if you want your information remain private, so that it shouldn't be shared with anyone, you can only use only phone data or secure internet connection at your home. If you are using public computer, public Wi-Fi, there are risks involved, because if you have a healthcare appointment, use your own devices or reliable devices, and you know where you are logging in at least. So we will go to the internet browser and we can access Zoom. So sometimes there is enough time. Usually healthcare provider send you a link for the video call. You will receive a link in your email or on any other platform. You will get a link. You see first, is it a doctor, healthcare provider, or healthcare team, pharmacist? You see who is the sender. Don't open any other link. First see who is the sender, who is sending this message. You will know if you already booked an appointment, is this coming from your doctor's office. So you will know what is happening. Then you click that link. We will give you this example for Zoom. So we will click that link. So for Zoom, you don't need to open an account. If somebody is sending you a link, you can use it with the link. The other platforms are also similar. So you don't have to create an account. You can open it from the link. Sometimes when you click the link, if you have Safari, Chrome, whatever we talked about, it will ask you, do you want to open this link or not? So you click it to open. Then you have to join. Then it will prompt you to join the meeting. So you will see. Sometimes it's very confusing because you can see the screen, but you are not seeing the healthcare provider. Then you get nervous. But sometimes, first you have to set your video. If like Zoom gives you two options, are you joining with the video or not? If you want to see the healthcare provider, if you want to show them something, so if there is a lump or something, if some swelling, then you have to turn on the video. So when you turn on the video, it's the same thing like we have the interconnection where you are sitting. It should be a secure environment. If you are sitting at home, if you don't want to hear, if you don't want someone hear you, then you can stay in one room. If your children are joining you in this meeting, you can bring them in. But if you are walking outside, or if you are sitting in a cafe, then don't do your healthcare appointments there. Don't do that. Then once you pick up the video to join, then you can see, you will be able to see the pictures. You can see your pictures, your healthcare provider's picture, your pharmacist or your team. Then you can see them. Sometimes you can see the screen. You can see some symbols. You have to change the sound sometimes. So double check before I talk about other processes. You have controls on the bottom. They are controls for your video, for your mic. Sometimes patients, I cannot hear you or you can't hear me. Then at the bottom, they mute your voice. So there is a chat function. You can chat with them. Sometimes your providers can send you the files. They can send you the information with the links. So they can send you the links. Right on your right side, there is a link, and then you can. Sometimes the providers finish the meeting, end the meeting, or you can press a button, leave the meeting. You can press that button. Sometimes you can't reach. There are the waiting rooms. So at that time you cannot see your provider, only the white screen. That means sometimes your providers haven't started the meeting yet. So then at that time, just check the settings of your computer. Don't get tense. Don't worry. Once they will start the meeting, then the meeting will start. It's very simple. So we talked about Zoom today, but if your healthcare provider shows you another video, gives you another video option, another platform, you can do that too. So now we will talk about self-management.
Why is self-management important? We talked about so many things today, provided the information by so many healthcare providers. But self-management through support resources is very important. So you can take steps for yourself. You make your own health plan. You're not alone in this. You don't need to do everything by yourself. There's so many resources available. First of all, resources, healthcare team. And, as you heard about the speakers of today, there's so many resources you can use at home today or, these days about awareness, if that's what's needed, and you have access to it. First of all, we'll talk about HealthLink BC. It's the 811. It's free of charge, available 24/7. It's open. You can phone 811. You just need to dial 811. And if you dial 811, there's somebody available there. They will ask you why you called. And we use 811 when we have some sort of confusion. We need to know what to do. We need some advice. And we don't know if we should go to the hospital or not. For those issues, you can dial 811. And when you phone 811, they'll get your information and they can connect you further to a registered nurse, to a pharmacist, to a dietitian. 811, it can also book your medical appointments, but it's all done online. As I said earlier about Zoom, so they will use something like that. 811 is available in Panjabi, Hindi, English, and many other languages. And if you want to use other sources 811, you don't need to dial that phone number. You can go to website. You can say type healthlinkbc.ca. You can get information about diabetes, and that's all available there. And another source is Diabetes Canada, and it's resources throughout Canada for whole Canada. And there is information available for the patients, and it's available in Punjabi as well. And you can go to Diabetes Canada website. You can connect to their website, and you'll get all the information there about what is type 1 diabetes, what's type 2, what diet you need. So you can just go to www.diabetescanada.com, and you can use it at home. And then there are family caregivers of BC. But if you don't have diabetes, but somebody at your home or in your family has diabetes, and you're their healthcare provider, and you can get that information. And you're also working, it's creating so much stress for you. You have to look after everything else. So family caregivers can help. So go to familycaregivers.ca, and you can go to resources, and there are support groups available as well. And I'll just take 2 minutes and finish this. There's a pain BC. If you have pain anywhere in your body, in your nerves, and if you think when you walk, you have some pain, you can get more resources by going to Pain BC. And Pain BC, there's a health exhibition here today. You can go to them for resources. And then the Self-Management BC, it's a program by Victoria University. They have a program how you can self-management diabetes at home, hypertension, how to manage yourself, and you can get more knowledge, skills, confidence. And then there's a Jim Pattison Diabetes Clinic. Harvinder is here. She is attached to Jim Pattison Diabetes Education Clinic. And this is especially connected to the program with the diabetes type 2 program. And only a healthcare provider can refer you to it. You cannot go there directly. And then there's a Fraser Health Virtual Care. And that just started last year. Through this program, 1-800-314-0999. You can talk to a registered nurse, or you can go to their website and chat with them. And there are only a few hours they are open. But it's a Fraser Health specific program that you can use. And City of Surrey is here as well. They have age-friendly seniors program. You can ask them questions. And where do you need to go there? Questions about transportation, which park to go for exercises, and which buildings to go to. They have ramps and access for you. You can ask City of Surrey about these things. And Surrey North Delta Division of Family Practice there as well. You can ask them. If you need family doctor, you can go to them. You can ask them. And Primary Care Network on their website, you can see that as well. And you can ask them questions about that. They're here as well. And Diversity is here as well. And they also help you with computer resources, housing, jobs, language services. And you can go meet them today. And Options. And they provide similar information. They can give you information regarding housing, diabetes care, community resources. They are here as well today. PICS, you might have heard about them. They have different programs. They have so many different services. They are here as well. Please visit them as well. You can ask them questions. And lastly, South Asian Health Institute here as well. And this is especially for South Asians and how to improve their health. And you should go visit their booth as well. And you must have heard Banana Community Health, Community Free Kitchen. If you're interested in volunteering with them, they provide different foods. And lastly, Icon, we are always here. You can get information. But thank you very much. And you have helped so much by being here today.
Thank you so much, Harleen. You provided us with very adequate information. It's very important for our community to get it in our own language. So very good information. There are some booths outside. When you will go outside, you can see all these booths, and then you can get more information, detailed information. Any question, it is very important to question the specialists. We haven't received any questions today so far. It's the golden chance to ask your questions from the experts. Anybody who is a caregiver, anybody who has any concern, any question, you don't know where to go, what to do, any problem, any difficulty, how you get out of that, any help you need, please ask questions so that you can receive answers today. To me, it looks like you have a lot of questions for Harleen. When we are in the age of technology, we are scared. Our elderly generation, they have issues. Even my parents, they don't know. They are scared. They don't want to share information via technology. So because they are scared of personal information, they don't know which is secure, which is not secure. So our staff members are waiting for your questions so that we can start our question answer session. So please ask questions, and our experts can answer your questions. So there is another survey that's very important. We are getting it done about all this program. So we will collect it after this program. So anything that is made available there, please fill in this survey. Whatever health services are provided to you in your language, so we cannot improve them. Like ICON or the other health systems cannot improve them if you don't give us feedback. So if you want us to improve, if you want us to do something differently, so please let us know. So whatever changes you want us to bring, we cannot do it. It's not possible if you don't let us know. So please fill in the survey today. So people who are watching it online, watching this program online, please scan the QR code, and then they can fill in the survey. So they can also send us questions, and we can send answers. We will try our best to answer all your questions. So next program is with Guljar Chima. He will bring the question answer session with you. So all the experts are here. Whoever give their lecture, please come to the stage. So Dr. Chima.
Please, all of you come to the stage. You must have some questions. We'll have some seats here. And after that, if you want to ask some questions, we'll try to answer your questions in the next 15 minutes. And if you got a lot of information today, and there are a couple things that you probably want to know more about. And if you have any questions, please ask. Every question is a good question. So please go ahead and ask them questions. We'll bring a mic, please. Just a second. It's really hard to get appointments with doctors. And even if you get an appointment, they don't spend much time with you. It's in and out. It's very difficult. We are waiting for Dr. Chima. Dr. Chima is the family doctor here. And it's a question. And the question is, it's really hard to get appointment with the doctor. What can we do? This is not a question for me that I can answer. In Canada and BC, this program is about your health. And any technical questions about the medical system, I cannot answer those. The best way to do that is talk to your family doctor about your members, that, there's a shortage of family doctors. They are trying different things. I do understand. You have other resources as well. And everything is not for a doctor. There are other options available as well. Approach those. And there are some improvements coming. There's shortage all over the place, not just in BC, not just here. And we cannot blame any specific government. And there will be changes. They're making some changes. And ask, inquire. A lot of people come to our office. We cannot do that. We can only provide so much service. And just let's hope for the best. If you have questions regarding diabetes center, you can ask your doctor to send you to make your referral to the diabetes clinic, and they can refer you to a clinic. So if you have any diabetes related question, you can ask them. You can call 811 and you can go through your virtual health and access that. But if you have any urgent care needs and if you need to see your doctor, you should do that. And I want to add a couple more things to it. And you can visit them outside. And, if you have any question regarding diabetes, please ask those. And there's a referral form you can ask them to fill. They send it to you. And then every 4th month they follow up with you. And it's not really important to see a doctor, 20 times a year or 4 times a year. You have to try yourself, but access is available. But if your sugar levels are really high, then you can call to a diabetes center. Then we try within 10 days to accept your referral and contact you. But if you think it's appropriate to attend classes, and we have the online classes available as well, we can start those. And those classes are available in Panjabi and English as well. But it depends on your sugar levels. And you want to see them in 10 days or more than that, or you need to see them in 4 months. And there's another question, Dr. Pada. And we received from if we need a reference. If anybody wants to see you as a patient, can they approach you directly or not? In BC, there's a process that family doctor need to send you the referral. Talk to your family doctor. They can send you further, and I'll be happy to see you. Next question from the audience. Asian people, South Asian, why they face the highest risk of diabetes? Can you use that mic, please? See, in our community, from 1,000 years, it's the same problem. Based on our genetic makeups, we cannot change it. We can change our diet. Our diet used to be very simple, rice, flour, beans. People didn't have much money to afford other things. And, with the time it has changed. You have more diet options. But our thinking hasn't changed. we are still stuck in there that we are going to eat more. If we didn't eat enough, it's not good enough. If we don't feed our kids too much, it's not good enough. There are so many options we have now. We cannot change our genetic makeup, but we can change our eating habits. We can change our exercise habits. We can do more exercise, yoga. That's a good example. In Hindu Mandir, their program, they are here. The senior center, they have exercise programs. There are so many different ways. You have to find what it's a right fit for you. We cannot change what we are. But we have big strength, but we have some health problems as well. There's a question, one person said, they have sugar, and their feet have a lot of problems, so it hurts. But when they go, they said circulation is fine. What can they do? I can just say one thing. When you go see the doctor, it has affected your feet. And that means you have a problem for a long time. They'll check your arteries, they'll check your feet, they'll check your nails, your toes. But it has been going on for such a long time. But there are not many options to correct those issues. The main thing is control your diabetes from now on, so that you can save yourself in coming years. All those issues are temporary issues, whatever they can provide. You need to exercise, it's very important to decrease your weight. Keep your feet is very important, and proper shoes are very important. So all those things are important. Nurse practitioners and other specialists that we have, they'll talk to you. You're asking those questions in the end. But when it started, you didn't pay attention. You didn't look after your health or your sugar or your diabetes. And sugar affects your hair to your toes, to your nails. And you have to take your own responsibility. And we have also seen that if you're vegetarian, we don't eat meat or egg, and we take metmorphin. When you take metmorphin, we've been taking it and we vegetarian, then vitamin B12 goes down. And if you have deficiencies of that, and then you get that burning sensation and numbness in your feet, and it affects that as well. You can check you ask your family doctor. It is also possible that it's because of that. And to control your sugar levels better, whatever damage has been done, it's been done. But if in the future you can control it better, and that can help you a little bit. And plus there are medications available as well. You can ask your doctor to write it down for you, and that can help you in a better way. And one more thing I just want to add. Recently in BC, and there's so many, government has made many relaxations regarding medication in BC. And we used to prescribe, your sugar goes through your urine a lot more faster. Earlier it was not covered, that medication was not covered, now it is. And there's another issue that pharmacists can explain to you. When every year you file pharmacare, it's very important to have pharmacare registration so that all your medications can be covered. Look at the different options. There are so many different medications. You don't need to worry about that. There will be improvements in coming years.
I will ask next question. Now we have a lot of questions. If we couldn't answer these question answer period in this period, because we have another question answer period at the end of the day, so we will try to answer those questions, but some questions are more important to answer, so we will try to answer whatever we can. These questions are related to each other regarding diabetes. If they are suspecting that they have diabetes, can they request a test for kidney function? And then there is another question. If there is they are urinating more frequently, do they have diabetes? If they can see the white cells, do they have diabetes? So can we explain about that? Look, these questions are very important. These are the symptoms of blood sugar, frequently urinating, gaining weight, losing weight. There are issues regarding eyes. If you see the makeup of your family, if there is anyone who have a sugar, if your weight is okay or not okay, so at that time you it's very important for you to get and see the doctor and get it checked. So we ask for fasting sugar checkup. So you go see the doctor at a time and get the requisition hemoglobin A1C. Please check. So you don't, it's not only one time, you can get it checked 4 times a year. So get it done with fasting A1C. So when we get it checked, we make a mistake. We get a requisition, we run. Wait, check the requisition. There is a form for 3 months. You show it whenever you go to the lab. Take a slip with it. Every time you don't have to get a requisition from your doctor because there is a slip that they can give so that you can get it checked from your person and go to in person what is the issue and you can get it with the so you don't worry about the sugar that's 1 week prior to that. So it's very important. So it's very important to get the test done. It's your right. So don't check your sugar 4 times a day. It's useless. Just see how you are doing sugar wise for a long time. How was it for a long time? It's not right to check it now, check it again, check 3 times. It's not good. It's not practical and it's gonna overload the system. Dr. Padda, you can talk. I agree with Dr. Chima. Hemoglobin A1C could be requested from your doctor. You will know from that if you have diabetes or not. And white blood cells, it doesn't mean if they're present in urine that do you have diabetes. So if you get more symptoms and you talk to your family doctor, they can do all kind of tests. Whatever seems appropriate to you, they can help you. If you can talk about protein and urine, it should be there or not be there, or how much it should be. The protein shouldn't be present in urine. When you get your test done, there is we call it ACR, albumin ratio, that shouldn't be detectable. It shouldn't be raised. Could be infection in your urine, maybe it's up because of that, but your doctor can test in the repeat test if it was because of the sugar or is there anything else or there is something else. So it shouldn't be at a detectable level, not should be high level, it should be negative. It shouldn't be detected in the urine. There are more blood tests. We can also detect sugar, or if it's affecting your kidney function, there are more tests that could be done. So for testing sugar or diagnosing it, the proper way is OGTT. We should be doing that glucose test, especially if there is a problem with our hemoglobin. If our hemoglobin is too low or too high, then our A1 is not going to be accurately shown. So there is another test where there is a glucose testing, because you have to have a drink and then you have to wait an hour and then your test is done. So if we don't have sugar, then we don't recommend further testing. If we do have if you do have symptoms, you get it diagnosed, and then we can recommend further testing. The protein issue, I assure you there could be many reasons that the protein is leaking in urine. When you get diagnosed type 1 or type 2, it's not only protein you get checked. Note two things. Tell your doctor GF1 and serum creatinine test. That is the true reflection of your kidney function. Then you have to make a list. If there is a problem, then they will check every 4th month. When you check your sugar, they will check this as well. That they will say you if there is a little problem, but the little problem in 3 to 5 years will become big problem. So then by the time you are only on 6th stage of your kidney and you already need dialysis. So it's very important. Hemoglobin A1C, ACR, protein in urine, and serum creatinine test. These are the simple things. Note these things. These are very important. Make a list, and as Harleen described, all this information, do it on you can do it on online. So note all these things and all these tests regarding the sugar, and coming time is more and more important. Dr. Chima, what is A1C? Please explain that. Hemoglobin A1C, already Harvinder explained to you very nicely that our sugar is very important for our life. The cells are not going to work without it. When sugar is more in our body, that's red blood cells. When it's deposited on the red blood cells, so when everything is in excess, then it's going to find a place and it's going to collect there. That's what it's called, hemoglobin A1C. Then the red blood cell span, A1C test is very important for you. Fasting is more important than the fasting sugar. A1C is more important. GFR, it's very important. Glomerular filtration rate is especially for kidneys. How much kidneys is filtering, how much they are removing fluid. This is the test about that. So it shouldn't be in excess, present in excess in your body. As Dr. Padda showed you slide, the layer she showed, there will be difficulty in those layers. There will be problem. The filtration rate ratio will be spoiled. So in your brain, when you see the doctor, ask how much damage is to my kidney, what stage. There is one stage, in the end stage, there is a lot of time to reach there. So it's very hard, 100% difficult to control at the end stage. So it's very important you get yourself familiar with this terminology. Yes.
Yes, I agree with that. And that with the kidney functions, it's so each and apart, as doctor explained. With that explains which medication is better for you, which is suitable. It's a better market that way. And after 3 months, people ask, how many times and how fast, how soon you can get it checked. We recommend it every 3 months. If you check it every month, it's not going to change much. So need to check it at least every 3 months. Keeping time in mind, we'll just ask one more question, but we have more time later. It's for Dr. Pada. If you have family history of heart disease, heart attacks, do your kids need to watch out something, or worry if they need to take any medication beforehand? Every person should see a family doctor at least once a year. If you have any concern or not, you should have one full body examination, all the tests done at least once a year. blood test, there's a urine test, and your examination as well. So it's really important to at least go once a year, either you have diabetes or not. If you have family history, tell your doctor about it. Then they can get certain tests done. Then they'll know if you need any medication, if your kids need any medication. When we talk about genes, that we have some issues or disease in family, but it also based on your lifestyle, your diet, what you take, what changes need to make in your exercise program. You can prevent certain things so that you don't get those illnesses. The concept is about family care. It has changed, and doctors' role have changed as well. Pharmacist can also do similar sort of work. Your nurse practitioner, your eye doctor, all those roles are changing. But ultimately, you should see your family doctor at least once a year. It's really important for other things as well, and it's creating a lot of problems, issues for everyone. If you start having a problem and if you ignore it at that time, it can get worse. If I, before I pass the mic back to Prabjot, is one person who has been very supportive for last 10 years, former MLA, Tynehead. Oh, he was part of the initial government who supported this program. I just want to recognize him. Thank you so much, and thanks to all the speakers, all the participants, and the first session was really great, and I hope it has increased your knowledge and awareness. And thank you very much, Harvinder, Dr. Chima, Dr. Pada, and Hardin Chauhan. Thank you very much. We'll start the next session later. And now it's a lunchtime almost. You've been waiting for such a long time. We do understand that. That's why. And now there's a smaller session for all of you who will help you. And that's our next guest, Ritika. She will tell you what kind of exercise to do. You've been sitting for such a long time. What kind of stretches you need. What kind of stretches will be helpful to you. And we hope it will be really beneficial for you. And after 50 minutes of this session, we'll take the lunch break. And at 1:45, we'll start the next session again this afternoon. And there are different booths outside where you can get a lot of valuable information. So after having your meal, after your lunch, you can come back at 1:45, please. And these speakers will provide some information regarding stress, about your eyes, how diabetes affect all that. They will provide all that. And I'll invite on the stage Ritika. Thank you, Ritika.
Hello, everyone. As we now see, we have to take care of our lifestyle with diabetes or sugar. So as you heard, medication, exercise, lifestyle, and one thing that's free, exercise. For exercise, you don't need to go anywhere. You don't need even to get up. So how many hours now we are sitting down? More than 2 hours maybe. People didn't go out, we didn't drink water. So we will try. So how we can make chair our tool, and we don't have to get up. We will be able to work, and whatever problem, insulin sensitivity or obesity, or we can solve that as well. If we can make a chair exercise tool, and we remove the laziness, So with the same note, so set straight on your chair. So your backbone should be, some people are sitting like this, some people are sitting like that. Spine, so keep your spine straight. So there should be some gap between you and chair. So if we lean, it's relaxing sitting, relaxed sitting. This is active sitting. Active, as we say, active listening. People are asking questions, people are nodding. That means active listening. But active sitting is when we are using our spine. When our spine is straight, that means we are actively sitting. So then we are relaxing, we are harming our back. So there could be back pain, obesity. How important is our posture for us? So if we are sitting like this, our attention will be our belly, stomach, and if we keep on sitting like this, we will be obese. Some people half an hour, 1 hour they do exercise, and all these hours in between, if they're sitting like this, it doesn't help. So we will say not active lifestyle, we will say sedentary lifestyle. So we will try to keep set straight, to keep our spine straight. Not here, even at home, because diabetes is not from yesterday or today's issue, is lifestyle. So we're gonna try to live like this. So we will raise our hands. So we will clap. Very good. We will start again. Bring the hands slowly down and then another clap. One, slowly hands down and then long clap. Very good. Let's see who can raise their hands the most. Straight. So what happens to our spine? It's getting straight. So if we go straight, the spine will be more straight. Try as much as you can go straight. So our spine will be strong, stretch, and it's gaining strength. So because it's getting stretched, some people may be feeling pain. We call it opening stretching. So slowly try, go to your left. So go, very good. So go on your left. You will feel the stretch on your right. So so all the organs in the abdomen, they are really getting compressed, and the right side is getting stretched. So there is some stretching happening. So now come back slowly, go to the other side slowly. So now the other side is stretching. So try not to bend forward, not to lean backwards. So this is a sample stretch, how much stretching you are getting in your shoulders. So now we will do the same exercise with our breath. So take the long breath and then release it. Very good. So taking the breath and then relax and then go slowly is very good. Then come back straight slowly and then slowly let your hands go and relax. How do you feel? How about shoulders, spine? Nothing else we have done. And already we are feeling energy in the body. Yes. Everybody can do this exercise who have back pain, shoulder, frozen shoulder. So your body will tell you. Our body is itself a doctor. So if my hand is not going up, so slowly stretch as much as you can. Your body will tell you. Try slowly taking your hands up.
Take your hands back, all the way back, and try stretch as much as, and open your chest and your lungs, and then bend your hand downward and go forward. Ha. And same thing, taking deep breath in and going back. Hold, 1, 2, and ha. One more time. synchronized, inhale, go back slowly, go back, 1, 2, and then forward. Beautiful. And now slowly coming back. How do you feel? How is your body? It's getting easier. In yoga, we call it. It's like behaving like a child. If we become 3-year-old, how wonderful that would be. If that body, if I ask my 5-year-old son, how do you feel? He'll say, very good, very good. Yeah. If I ask you, how do you feel? You'll say, very good, yeah. Then do it again, very good, yeah. Good job. And then follow my clapping, follow my hands, palm, 1, 2, 3, 1, 2, 3, 1, 2, 1, 2, 3, 2, 1, 2, 1, 2, 3, 2, 1, 2, 3, 2, 1, 2, 1, 2, 3, 2, 1, 2, 3. Other side, 1, 2, 1, 2, 3. Up, 1, 2, 1, 2, 3. Side, 1, 2, 1, 2, 3. Other side, 1, 2, 1, 2, 3. Straight, 1, 2, 1, 2, 3. Very good. And now, slowly bring it down. And you feel, what do you feel in your palms? Like some tingling, some sensation. What do we do? All the nerves, blood circulation, we open all those. What's happening in the heart? Look at, feel, put both your hands on your chest. Your heart rate has gone up. What did we do to the heart? We open up all the heart vessels. We increase the heart rate and the breath rate. If we do that and use it, we change the energy in 10 minutes or now. Or how do you feel? Just with one exercise of the hand, stretching, right? And we do so many things with the chair, but otherwise, because of the time, we couldn't do it. The second medication is laughter. Some people don't want to laugh. Is there anybody out here? But we have forgotten to laugh. We want to see a comedy show to do that or other thing. Our body doesn't know if you're really laughing or just making it up. If laughter is a medication, it's free. You don't need to get it from a shop. There's no marketing, no sales for it. That's why we don't do it. And laughter is really important as a medication for our lungs, for blood circulation, for stress management. Our stress, when we take a breath, we release it. We should take a deeper, longer breath. It will increase our life. It will increase our activities. And it will increase capacity of our lungs. Energy will change. And it will promote our health. Is there anybody here who doesn't want to laugh? No, I know everybody's getting hungry, so that's why we'll make healthy milkshake for you, but I need your help with that. Should we start? Take 2 glasses with you, 2 empty glasses. I'm about to add milkshake in it. In India, they say milkshake, how do you mix that up? There's no mixture there. So you're milking it, you're mixing it. Ha, ha, ha. So both hands you're doing ha, 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 ha. You're laughing. Guess, how was that? Very good. There's so many people there who are lactose intolerant. What do we do then? Then we give them PEG. Do it one more time. Ha, 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 ha. How was that? Very good. One more time. Very good. Very good. Yay. And clap one more time. 1, 2, 1, 2, 1, 2, 3. 2, 1, 2, 3. 2, 1, 2, 3. Last time. 1, 2, 1, 2, 3. We'll do it one more time. One last exercise.
कोशिश करेंगे कि
So we will try that there is no chair on the back, right? So look around, don't fall, there is no chair. So we have a chair behind us, so we will get up little. So there is imaginary chair on the back, so we will get up this much. So you are frozen, you can't sit. Can you do it? So you guys did it with me. This was a trial. Now we will do it for you. And then we will count. My math is weak. Sometimes I forget. I'm sorry. So I'm already forgetting. So let's try. So take the palms up, inhale and exhale, and then get up slowly and start counting. 1, 2, 5, 6, 6, 7, 8, 8, 9, 9, 10. Beautiful. Good job. So for diabetes and sugar, if we can do this much exercise every hour, there will be movement in our body, there will be no insulin sensitivity, sugar will go low, no obesity will go low, and will improve breathing. So stress relieves so many benefits, and it's all free, right? Thank you very much. And I think, and then the rest of the program. Thank you so much, Ritika. You have brought the so there is very good food outside waiting for you. You guys worked hard. You have exercised now. Everybody deserve a nice lunch. So let's go have a lunch together. And there is so much information and resources available outside. We'll have lunch and come back. Thank you so much, everyone.
That was awesome. ਥੈਂਕ ਯੂ ਸੋ ਮਚ एवरीवन ਵੈਲਕਮ ਬੈਕ ਕਿੱਦਾਂ ਲੰਚ ਇੰਜੋਏ ਕੀਤਾ ਕਿੰਨਾ ਸਵਾਦੀ ਭੋਜਨ ਸੀ ਅੱਜ ਵਧੀਆ ਸੀ ਨਾ ਬਹੁਤ ਵਧੀਆ ਸੀ ਥੈਂਕ ਯੂ ਸੋ ਮਚ
Thank you so much. So the first session was full of information, and the second session will be even better. Especially that you are concerned about medications. All your questions will be answered in the next session. So there are some important things I want to talk about. So there is a complaint about the first session that some people are talking on the backs. So the session is very good, it's full of information. So try to get all this information. So please try not to talk and then get the information we are here for. So please turn off your phones, turn off your ringtones when we are providing information, then everybody gets disturbed. Please turn off your phones, switch off your phones whenever the speaker is done their speaking. Then please prepare your questions. So at last time we got the answers on the last questions on the last moment. Then we don't want any question left. We want to answer all the questions. So try to write down the question when the lecture is finished, when the experts are done their presentation, try to write down your questions then. So provide us with your question right away so that we can answer all your questions on time. So we will start with Dr. Chima.
Welcome back. Before I start the program, a gentleman, Mr. Jagtar Singh Thandi, approached me, according to him, and he has attended all our sessions in last 12 years. And he said, according to him, how his health is so much better and diabetes controlled. If you follow something consistently, it will improve your health for sure. Thank you. Thanks for sharing your good story with us. And our next speaker is Preeti Suri. And according to her type 2 diabetes that we're facing, all presenters are here. Everybody is very well qualified in their own language, in their own profession. They understand your language. They understand your concern. And everything all put together, what are we going to do about it? How to take care of our health by eating well. It has very important role in our life. When we read about it, the time when we went through a medical school, there weren't many options available. And, all those things were wrong, what we were told at that time. And, all the rules, all the regulations are being defined. There are different professionals, ophthalmologist, dietitian, practical nurse, to benefit all of us, patient and caregivers. So all our presenter, and especially Preeti Suri, her introduction is very long. I'll try to give you very short in 2 words. That I just want to tell you that she knows diet regarding diabetes, regarding sugar control, and it's a very bigger source through ICON that we've been doing for the last 10 years. And we've been benefiting from her services, and many people have benefited from her instructions and education. But in the community, we have our responsibility as well, and she's participating. And you can go on internet and check anywhere about her, and you can watch her on YouTube through ICON. And we have added more than 100 presentations in our ICON website, and those are very great presentations. And sometimes they go to the temples, the gurdwara, the churches to present information, and they tell you that you should eat whatever you need to eat based on your needs. And Health Canada has created new food guideline. They have changed it, and what she's going to teach us and tell us today. And her introduction is very important, I think, and I wanted to share that it should be, she has been consistently supporting the community. Thank you.
Thank you. Hello everyone, welcome. Dr. Chima, thank you for warm welcome. As Dr. Chima mentioned, my name is Preeti Suri. What we get from diet. So I'm a registered dietitian, and I have a long relationship with ICON. So I'll share with some new information with you today. So we always talk about diabetes, how we can stay healthy while we are having diabetes. So manage your blood sugar, that's the only way. So how we can manage blood sugar? Eat well, eat balanced diet. So that's my department, how we can eat well. So this slide I'm going to show you again. You also saw it in previous presentations, who have diabetes, so you bring home a cat. C stands for choice, A for amount, T for time, cat. So what food you wanna eat, what kind of what choice, and what time, how many times. CAT is very important for for managing the blood sugar. So we will talk about choice of food now. So you have seen it before in the icon presentation. We already talked that we should have a whole wheat roti or naan or paneer or tofu or how much fat you, so how much salt you have to eat, you should eat. So what kind of food you so we will look at it today. Banana, if you eat banana or naan, so you can make any choice after the digestion when it will be it, turn into glucose and sugar. So how it enters our bloodstream, how it is absorbed. So if you make a choice for banana, so if you eat sugar, what kind of effect you will be getting for eating either of it. So different kind of food, we will get different kind of carbohydrates and different amount of sugar. Our body needs sugar. It cannot function without it, as it's like the gas in the car. So we body cannot work without sugar. No normal thinking of so any responsibility, our brain or blood circulation or heart or any function, you can take any function, sugar is very important. But if you are eating it in excess, then it will be a problem for managing diabetes. So our choice of food, and then we will talk about which food has more carbohydrates, more sugar. We avoid those foods. For example, if it's winter time, it's ending. So in peanut, who enjoyed the peanuts in winter and pinny. So if we don't eat pinny and people eat chocolate during Christmas, besan in our homes. So we can't live without those. If you eat two pennies with one glass of tea, and then you check blood sugar, you will see the difference. That's what I want to point it out. What food of choice you and what amount you chose and how many carbohydrates you consumed. So this amount of sugar you got it from the food. If we see it through the eye of science, so healthcare professional, how they count it is glycemic index. So through the research, you see the educational flyers, you must have heard about glycemic index. Yes. So when glycemic index is more like, it's like a percentage, like we were getting marks at school from 100 to 25%, like. So if we give more percentage to the food, it has more sugar. So we give a less whatever food has less percentage has less sugar. So that's the glycemic index. If you have more numbers, distinct with 50% or more, is it's not gonna benefit you. So you try to, you will fail because of the glycemic index. So it's a big name, but most of the complication.
The glycemic index food.
So, when you look at the guides, they talk about glycemic index and the food, low glycemic index foods, and then that increases the sugar less compared to other high glycemic index food. And in this graph, they have shown what percentage that has high glycemic index, and they will provide more sugar. and the blood sugar will go up faster in your bloodstream, and it will be less than higher but more than low, and it does not increase the peak as much. And it's the same thing, talk about red light, same thing. Sometimes because the visual cues help us better, there's high, there's a medium yellow, and then the low, that's green. That's safe for us. And then there's so many foods I have put in this table of glycemic index that we should avoid these foods. We are not saying we don't need to eat it, but we are saying we shouldn't eat it that often. The medium is better. You don't need to raise it too much, but the low glycemic index, according to that, it should be in there. For example, heavy mixed grain breads. There's so many different varieties of breads available. Don't go at the name. Don't look at the name. Look at the texture of the bread. If it has it has coarse grains, and if it is not refined flour bread, then it's not good. But if it is coarse, that's better. That's heavy mixed grain. Spelt bread, that's the same thing when we're talking about one with the. And then there's sourdough bread, that's a little bit sour. There's tortilla, used tortilla, all whole grain. Barley is fine, and a lot of people use that in our community. Pasta, that's green as well. Quinoa, that's a good choice as well. Rice, converted or parboiled. And the medium that you can eat once in a while, but carefully, not that often. Then whole wheat, whole wheat bread or naan, and that should not be it should not be fine flour, and we can call it bran. That should be in there. But what we use mostly here, roti, that's a medium glycemic. The brand that you use in there. Pumpernickel bread, that's a good choice. Everybody doesn't like it, but I put it in there because if you want to try, you can. And there's a wheat bread and rye, some ask, and basmati rice that we mostly use at home. That's in the yellow category as well. And couscous, cornmeal, rice noodles, and that's in that category as well. Then I really want to point out the white rice that looks like brown, the basmati rice. That's both are in medium category. Did a high glycemic index. They said brown rice, wild rice, but they're harder to chew and hard to cook. But basmati rice is in the yellow option. And the high glycemic index, the food that you should absolutely avoid, that has low fiber, that's like jasmine rice, millet, sticky rice, and white bread, naan. Our people don't like it, but if you want to try it. Now, second thing about glycemic index, that we're talking about fruits. We can eat apple, banana, grapes, mango. It's a season for mangoes. I provided this chart especially just making sure there's only one food in red category, that's watermelon. And then again, I want to explain again, it's not that you're not going to eat watermelon at all, but avoid it as much as you can. And there's a lot of water in it too, but it has a lot of sugar in it. And the ripe bananas, that is yellow, once in a while that's fine. And all the other fruit, apple, apricot, banana, berries, cantaloupe, grapefruit, honeydew melon, mango, this time of the year, orange, peach, pear, plum, pomegranate, prunes. These are all in green category. So even if you have diabetes, type 1, type 2, or even if you don't have it, they're all healthy and they're low glycemic index and they won't increase your sugar that much. And going ahead, now we're talking about the vegetables. Any vegetable, they are not in high or avoidance category. There's only one thing, potato, that's in yellow category. When I'm looking at you smiling. When we ordered the food today, we told them specially that we don't want potatoes. You can put any vegetable in there, but no potatoes. But I don't know somehow why. I don't know if I should praise it or not. It's a way of hospitality. Until we put more stuff in there. If we don't follow traditional recipe, we don't feel like we are being very hospitable and hosting, and we're talking about other eating out and stuff. But avoid potatoes. But you don't have to put potatoes in everything. But you can put less. So there's only one vegetable, that's potatoes, you should avoid. But every other vegetable is in the green zone. You can steam it, cook it, whatever, however you want to eat it. But all the vegetables are allowed. Broccoli, cabbage, celery, cauliflower, eggplant, and squash, zucchini, everything you can eat, all that. And then we can talk about dairy or meat alternatives. We're talking about milk, yogurt. And you can drink milk, yogurt, chickpeas, kidney beans, mung beans, romano beans, lentils. All in the green zone. I want to go back. High index food, if we go back in there, what's in there? That's from starch, from the wheat. We should avoid all that as much as we can. But it's all good to eat any vegetables, lentils. You can eat as much as you want to. Where did I talk about this?
If like today's tray, gulab jamun or jalebi, so we even told that caterers not to provide this because this kind of food, there are natural foods, but these are the foods we made. It's man-made foods. So there we think we paid more attention to the taste, not to the portion. They are very high. They're high in glycemic index. So how much sugar in there, or there are other regions. So these foods are. If I knew that they are putting gulab jamun or jalebi, there is muffin. Now we talk about amount of food. See the one we talked about before, CAT. So there is a theory, big theory. Middle-aged generation talk about this intermittent fasting. Now everybody is so excited about fasting. So try to eat at this time and not eat for 12 hours, not eat for 20 hours. So if we talk about old age, your grandparents, there was a way in, so in the morning, you eat breakfast, you go to job, you go to farms, and then there is lunch time, and then after that there is dinner. So after that nobody will eat anything. After that, worship, sleep, take rest, spend time with the family. That's what all that's happening. But now our lifestyle is we are up until 11 or 12. People are drinking coffee, tea, eating chips. So that's why now we are in a trend of intermittent fasting. That time it was different lifestyle of eating. Once nighttime eating is done, no food after that to give your body a rest. Now I want to ask you a question. People who can't control their glycemic index or cannot control their diabetes, if you don't eat for 12 to 18, because your blood sugar will go low and crash. So people who cannot control their blood sugar, they shouldn't do this long time fasting. So first of all, you need to control. So there should be some time in our life that's for fasting. And now the amount of food, it helps in one way. You can think that am I satisfied if if I'm eating to eat or just to for my player. So now we will talk. We will attach it to the glycemic index. We have heard about carbohydrate counting. So we will go. They said us to count our carbs. So this is the way how many carbohydrate or how much sugar we have taken. So people who wanna use insulin, then they use the insulin. They adjust it as compared how much carbohydrates they have taken. They should eat around that, because with that your body will form a routine. When you have lunch time, like for example 60 grams of carbohydrate, if dinner time maybe 60 carbohydrate, 60-gram carbohydrates your body is going to take. That way your body gets into the routine. Then it gets used to how to metabolize those, and then there will be less fluctuation with the blood sugar. So the standard is, so the dinner 40 to 60 gram carbohydrates in your dinner, and the snack should be 10 to 15 gram of carbohydrates. I'll get to it in a minute. So you remember, most females is the rule of thumb. If you have bigger bolt than 16 grams, one serving, if we count the carb counting, it should be 15-gram carbohydrates in one serving. For example, one slice is one exchange, one serving. One roti of 6 inch, 15 gram carbohydrates. Half sabji of chana, 15 grams. So I simply made a meal here. 1 cup of khichdi, half cup of yogurt, half cup of salad, 1 cup of blueberries. So it's 4 exchanges of carbohydrates, which half cup of rice, 1 cup rajma, half cup kheer, one meal, 4 exchanges, 60 gram carbohydrates. Same thing, 1 cup chicken curry or matar paneer, 2 rotis 6 inch, half cup salad, normal cucumber, onion, tomato we make at home, half banana. So four exchanges. Same thing with the breakfast, 1 small paratha, 1 egg omelette, 1 orange, 4 carbohydrates, 60 grams. Now the last, I already talked about intermittent fasting. Now timings of meals. Eat every meal 3 to 4 interval.
And if for another reason you are late, you can have a snack or eat something else. And we're talking about eating out. And sometimes we say, we are going to visit somebody, we are going to go eat out so we can miss the lunch. That's the biggest mistake, especially if you have diabetes. Even if you don't have it, if you go to them to see somebody, by the time you meet and greet and sit down, and you're late and you're hungry, so don't miss your meal, but follow the routine that you have made yourself. When you're eating out, if something is served, and so first check what's there, what's available, and don't fill your plate. Just take smaller serving. First of all, drink water first. And whenever I go to a party, I always have a glass of water in my hand to avoid overeating. So that way, you eat less. And some people have smaller plates, so we have more space. And people who drink, I'll say, I have not received any paper or anything, and no reason that it's important to do. It affects your sugar levels. It affects your meal times and a lot of different things. Alcohol, I don't see why it's needed, why you need to consume it. Same thing for soda, pop, sugar, coffee, which has sugar. There are other things. Last point I want to check. If you are eating fresh food or vegetables are not available, the groceries so expensive in the market. So canned and frozen fruits and vegetables are equally nutritious as the fresh produce. Sometimes they are freshly packed rather than the fresh food we get. Like a banana, if you're looking at a yellow banana, for 2 weeks or 10 days, it has traveled in a truck, and now it has yellow instead of frozen strawberries, and that they have frozen right after picking it up. So sometimes the canned food is better and more fresh compared to fresh food. That's it. Thank you. Thank you so much, Preeti. That was very valuable information, what she explained, what we need to eat. So if you have any questions in your mind, that if it is nothing is clear, please note it down now. And Sandeep is there. Please give it to him right away, note it down, so we can ask your questions on timely manner and answer those questions. And I just received an information, not in detail. As City of Surrey, we are in the City Hall. We formed this program. They are our partners in ICON, and they are going to have a draw. I don't know what that draw will be. I don't have detailed information, but they said they will win. And it will be awarded to the person who's present here. So I'll suggest that you should stick around till the end, and maybe you will win a prize. And our next speaker is Gurvinder Gill, who's a clinical pharmacist. She will answer many questions, and people have many questions regarding medication. So you will get a lot of information from him. Gurvinder Gill is a clinical pharmacist, and does have primary care and oncology experience. He's a doctor of pharmacy program, and he has done a lot of research and articles on this profession, how a pharmacist is playing an important role, and he will provide you important information. And the information he will share with you today, and that will be supply and of the medications. Gurvinder.
Hello everyone, welcome. I'm Gurvinder. I'm a clinical pharmacist. So I will give you some information regarding the medications. You have questions regarding your medications. So I hope I can answer all your questions. We don't have that much time, but if you have any questions, if we haven't talked about it in the slide, you can ask questions later on. We will focus on insulin. We will talk about how often and when should I be checking my sugar, how to manage low blood sugar, and the focus will be the insulin. Unfortunately, in our community, there is a scare about the stigma about the insulin. Actually, A1C numbers, it can lower it, so it's very beneficial as compared to the other medication. They are also beneficial, but there should be no stigma about it. In the end, we will talk about the diabetic supplies, whatever things you need to manage your diabetes. So we will talk about those things, but the folks, how you can handle your diabetes. So in the beginning, I want to talk about when we are diagnosed with diabetes. Dr. Chima explained to you in very much detail. Metformin is started in the beginning. So it's been used to manage in our community for many years, and this has very little side effects, minimal effects. But there, with the new research, there are so many other medications in the market. So they work in those medications work in a different way. They could be given along with the metformin. So our try is, if we can lower the sugar level in by any method. There are other medications too. How the sugar is made in the liver and is distributed. Our pancreas, that's the one who makes the sugar, the insulin. So we should tell the pancreas create more insulin so that it could be distributed. There is a new Jardiance, there is a new medication. So that medication, when sugar goes in the urine, by the time it reaches to the kidney, then it comes back to the body. There is a new medication that sugar could be drained through the urine. Excessive sugar should be drained through the urine, and then less sugar will be absorbed in the body. There is medication that also suppress your appetite, and then it also could be given via injection. There are other medications that can control your sugar level. Every medication has a side effect. There is no medication that doesn't have side effects. So you talk to your doctors which is fit for you, what side effects they have, and what is good for you, and then how you can manage those side effects. There are medications, but if we cannot control or it doesn't fit you, then we have other methods, other options. So on this slide, as I told you earlier, A1C should be checked every 3 months. So this is the standard. You can talk to your doctor and get it from your doctor. So they can give you requisition up to 1 to 2 years. So you can go to the Life Lab and get it done. As Dr. Chima told you earlier, that's urine test. So check before you go to the doctor. Then you can give you information accordingly. Where is your situation? How much control you have on your diabetes? Usually, according to the Life Lab, it takes 1 or 2 days to get the blood, and then you can check your blood test.
Now, to check the sugar level, what's the benefit of it? The referral program we have, doctor can send you to attend diabetes classes and how to check your sugar levels. There are other options. If you go to your pharmacy, they can tell you about all the machines and give you education, how to use the machine. Why do you need to check the blood sugar level? But patients who are just taking one pill of metformin, they don't need to check every day. There's no need for daily testing. Then they just need testing. If they feel low sugar, they can check it. There are other medications as well that, because of side effects, they have low sugar chances. In those situations, then they need to check blood sugar level many times a day. Insulin is another example. When you use that injection of insulin, then you should know what your sugar level is. So then you can inject appropriate dose. And there are two different ways of doing it. One is the one time used one time a day. That works. On top of that, there's extra, if dose needed, then that's extra dose. That's the one given with the food. Then when that dose is used, then you need to check the sugar. As I shown in the chart here, when you start especially insulin, it's recommended that when you use that injection, check it before eating something, before breakfast, lunch, or supper time. the basal is for the long term. You should check it before. When your sugar is stable, when you know those doses are working, then you need to change the strategy. So then you should know that dose is working well or not. At that time, you have to use the other injection. Check it before breakfast, check it after breakfast as well. Same thing with the lunchtime, after lunchtime, and then after supper. So there are different strategies you need to use. It's different in every situation. And your doctor can also advise you how to use it at different times based on the side effects when you need to check the sugar. And told you about low blood sugar and what could be the symptoms of that. And there's some more information about that. When we check sugar levels at home, if it is below 4, that's low sugar. Low sugar, it's more dangerous than high sugar, can be more dangerous. So based on the medication, if you're eating less than planned or done more exercise, or if you forgot about the medication, took it again, all those things can change it. And alcohol use can also change it, and you can have low blood sugar because of that. What are the symptoms of low? Well, it depends on how low it is. If it is just a little bit low, you're sweating, you're trembling, you're feeling anxiety or nervous, or you might have headache. And if your sugar levels are going lower and lower, these side effects and symptoms can get worse. When your sugar is really low, then you can lose your concentration. You're able to consider anything. You feel weakness, you feel numbness. It can affect your eyesight as well. And you can feel dizzy and lose consciousness. So it's very important to pay attention to this, especially in our community. If you have that problem, you have diabetes problem, or you have it in your family members, then you should inform them that there's a possibility of you facing these symptoms, so they can help you. So at least if you are not conscious, then they know what to do, and then they can help you, especially if you're taking some medication that has some of side effects, insulin, especially insulin. Then you can have medical bracelet that you can wear, and if you need to call 911 or emergency services, and then they can help you based on that.
So, what is the how we correct low blood sugar? If it's low than 4 and you already did the test, so at that time you should have 15 grams of simple sugar. Some people were taking classes in South Vancouver that we have a candy. We keep the candy, so we take it when the blood sugar is low. Whenever they feel the symptoms, they can take it. But the problem is we don't know how much sugar in the candy, and we don't know how much low sugar you have. So at that time, you should have a machine with you. So machines that can check sugar are very small. You can keep it in the pocket. There is new technology where you don't need the machine. Whatever is suitable for you, whatever machine is suitable for you, you use it. But please check your sugar and before you treat it. So 15 gram of sugar, for example, if we have juice container, the juice container, half of it is 15 gram. You can correct your low blood sugar. If you have honey, glucose tablets, or even sugar, so normal spoon is 15 gram. You can take it. And I also want to mention, like you don't have to, the spoon shouldn't be fully loaded, like just a spoon, like that's what you are supposed to take. If you have juice, at home, or or glucose tablets. So so you can get it from the pharmacy. So maybe around $5 or $10, they are really cheap. So if you have low sugar, then you can have 4 tablets. So then you can correct your low sugar. So it's not like you took the tablets and you took honey and sugar. So after 15 minutes you check it again. Don't check it right away, so that we can make sure is it above 4, because it takes some time. So if you have done a lot of exercise and haven't eaten and took the medication, so there will be things that will affect for a long time. To correct the sugar, you cannot correct it right away. So you should check it after 15 minutes again. So if your blood sugar is okay, then you should eat the meal with the protein so that it doesn't go low again. So if you want to check it again and if it's still low when you check after 15 minutes, then you should need emergency services. When if you check again and it's still low, and then you take another 15 grams, but you might have to call the emergency services. Let's talk about insulin now. Like, there is a fear, like stigma attached to the insulin. Like, now you are diabetic, now you have to get a shot, you have to get an injection. Sometimes people tell you, people from outside or your healthcare provider tells you, it's a stigma, it's wrong. Actually, insulin is a very good medication. It can correct your blood sugar. The dose of insulin or type of insulin is given to you is also according to your A1C and your other health conditions is given to you. Your nurse practitioner or your family doctor or you, so whoever, and the insulin should be best for you and the doses should be corrected according to your needs. So what is insulin in the previous times? There will be small vials and then there was a long syringe, and you have to draw insulin and you have to calculate your dose before you take it. So now it's used for cats and dogs, not for human beings. So at this time, insulin it comes in a pen form. So there are pens. So it's very convenient way of using it. There are numbers on the pen, the dose for the A1C control if you are diagnosed with it. So, and according to your diet, it's adjusted. So you can adjust your dose, then you can inject. The needle that on the pen is only 4 millimeter. Before 8, 12 millimeter. Now it's very small, 4 millimeter. The thickness, how fat is the needle? So it's only 32 gauge. The piercing, the piercing needle is 14 to 18 gauge. So if you go smaller, then it's bigger. The needle is bigger and in diameter. So most of the patients tell me when they test their sugar, that the diameter of that needle is more than the one used to inject the insulin. But still, the pain is very little with this needle.
Now, how is the insulin dose is calculated? There are two common ways to calculate it. And if you want more information on this, we can talk about it later. If your sugar is not controlled or your sugar is really high and doctors want you to control it, there's a treatment available. And then doctor can start you with the basal insulin. That's once a day. It starts with 10 units in the evening time. And sometimes they suggested to take it in the morning as well. And the pre-filled pens are available. You can buy it for 1 unit or for 60 units. And it's all together. And as you are using it, it goes down and down, and you know how many doses are left. And the sugar we have in the morning, we want it between 4 to 7. But if you are using 10 unit insulin in the night, and in the morning it's not between 4 and 7, then next day you can increase 1 unit next, and keep doing that until your sugar level in the morning is between 4 to 7. Then we talk about carbo counting. As they told you in the last presentation, carb is needed when insulin is needed taken with the food. It's calculated 2 ways. One is bolus insulin, that's used 4 times a day. Then total daily insulin, and it's based on your weight, and it can be calculated according to that. So as you divide it, basal insulin is needed, or how much is bolus needed. So 40% dose is needed of basal, and before going to bed, and the other 3 times, then you divide that into 3 times. So 20% dose every time. And that's based on the carb as well. If you ate too much and you knew that you ate too much, and doctor or nurse specialist can help you how much to use. And with the experience as well, you will know which food and what kind of food, how much food you are eating, and how it affects. And in the last, I want to tell you about diabetic supplies. Now we are talking about in the community, like how do you get the coverage about these? If the doctor gives you a referral for education, to attend the education classes, and afterward you get the certificate, and then you get the coverage after that. And the things you need to manage diabetes, one is you need a meter, good meter. There are many different types of meters out there in the market. Depending on the features, sometimes you use at the phone, like a smartphone, there are so many different kinds. If you like it or not, some people don't like it, some people like other things. Some meters have bigger digits on it, easy to read, easy to see, and some people like those, and some people like the meters. They have easier testing features. Some people like those. So I'll recommend that talk to your pharmacist. They can show you all the meters. They have all the samples, and they can tell you which features they have, and you can pick according to that. And all meters are equal. You cannot say one meter is better than the other. So keep that in mind. It all depends on your choice. Next thing is lancets. That is the one that's used for testing. When you draw blood from your finger and you put it on it. Then there's a test strips. Then pharmacare does have some coverage depending on which medication you're taking. Then you get coverage for 200 strips. And then glucose tablets, you also need that. You should have it in your pocket all the time. Glucogen is for emergency. If your sugar is really low, it's to increase that. And I already told you about bracelets, medical alert bracelets. If if you show it, then people know that you're diabetic. And then insulin needles, you need those as well. We do have resources, as we said earlier. One is 811. You can call them. That's free. You can talk to them. You call them, and healthcare workers, and there's Diabetes Canada online information available in Punjabi as well. If you need more information, you can access that. Thank you.
Thank you, Gurvinder. There is confusion about a lot of things, but he explained it really well. And I'm wanna add one more thing into it. When we travel overseas, at that time, pay attention to two things: supply of insulin, because if your flight is late or something, and if you are late reaching to the final destination, your luggage is missing, at least you should have one week supply worth in your bag. So it's your duty to tell that you are diabetic. Then so people get upset. There is a lot of confusion about that. Then the airlines, they don't know, so we need to pay attention to all this. So keep these things in mind. So our next speaker is Dr. Mohan. And his practice is in Surrey. He graduated in USA, and all his study was in the USA, and his practice is in Surrey. One thing that's famous about him, well, no, sometimes people have difficulty conversing, then they go to him, and he will explain very well to the diabetic patients. You can see in everybody's presentation, all the presenters, after such a long time, that it very good way, very nice way to explain things. So Dr. Mohan, please come, and if you want to get your eyes tested, and if you want to treat your eyes when you are diabetic, it's a beneficial to you, to your family. You can talk to him, and how could you remain active in your life, and for yourself and for others. So in our community there is a lot of confusion. So I want to tell you all, MSP covers your eye examination if you are diabetic. If somebody is charging you, then in that profession, and you ask questions, and otherwise move to someone else. So Dr. Mohan, thank you. Thank you, Dr. Chima. Hello, Sat Sri Akal, welcome. As Dr. Chima mentioned, my practice is in Surrey. We will talk about today how diabetes affect your eyesight. We will talk about that. All right. High blood sugar affects your eyesight. There are studies, research. We will talk about that, how it affects your eyesight. But there are other things that it does beside the eyesight or affecting eyes. How often you should check your eyesight? So there are 4 main things that we will talk about, that how the diabetes affect those 4 things. So the green portion you can see, the front portion, and then the back of the eye you can see. So the blood vessels we can see very clearly. There's the site where sugar make problems. If you see the picture on the right hand side, there are 2 or 3 things. You can see those red spots. There is a bleeding. So the blood vessels burst on that spots. So first of all, how sugar affects, we call it cataract. So most of the changes, when the eyesight goes down, then it could happen all of the sudden. It's not that it will gradually happen over the time, but it could all happen in 6 months. all of the sudden the eyesight is gone. So we can do the surgery for that and it correct it, and it's covered in BC. So our ophthalmologist, they will help you with this.
And next thing is a lot of people are asking, it's talking about there are some things that can be corrected, and then the cataracts, there are no medications, there's nothing, no technology available that can be corrected. There's so many other things that can harm you and create problems for you that you need surgeries for. Contact lenses people talk about, and that can also harm you. What is one thing is for sure, they should check it when doctors are checking it. When they put medication in there and check it. If the doctor has not checked it without medication, they have not done their job properly. So they should always put medication in there first and then check it. And the second thing, what we want to talk about, what we call glaucoma, that's more dangerous. And we don't see much in that patients. There's once in a while we get patients, especially the patients who are diabetic, that can create a problem. But the problem with the glaucoma is that you should get the testing done. Ophthalmologist, optometrist can check it, right? Now we'll talk about the main thing about the eye doctors check. When your doctors are checking it to get the eye doctor to look at it, they want to see there are no damage back there, tissues start to become diseased from the diabetes. And on the left side you can see, and the right, what's behind the eye, that can lead to poor vision and even blindness. With that we see it. If you look at the picture, and there are multicolored things in there. There are red dots on there that we need to look at it. That we always avoid that, but we always check for it. And sometimes I get a patient, and they said, how come all of a sudden I get it? My eyesight is fine. Sometimes there are no problems, but later on it can. What I'm looking at now, I want to show it to you. But don't pay too much attention to it. But what we look at it, we did a CT scan of the eye, and it's not like it goes to and directly to the eye. And the other picture on the right hand side, they're showing where there's a problem with the diabetes, and that can be checked. How do you correct it? And then you need to use injections for it. And the presentations we are doing, all the professionals that are here, and we are teaching you, avoid it as much as possible because you can face these problems. I also want to say that most patients I see, when they go to India, they think, they can do whatever, they think they don't have diabetes. When they go on vacation, when they come back here, they want to get it fixed. But even if you go to India, you can still face these problems with diabetes.
तो बस यही स्लाइड ਦੇ ਵਿੱਚ ਹੀ ਬਸ
So this is all about in this slide. So there are some doctors, they don't have it, but usually you pour down the medication in the eye and then you do the testing. How to detect this condition? So after putting the medication in the eye, then you can check the vision, and then you should regularly see your eye doctor. Every 3-4 hours usually they check there, and then the patient thinks they don't have any problems, and then the answer is right there, like it's all good. We don't need to see the although I'm diabetic, I don't need to see the eye doctor, but the answer is false. You should see the eye doctor. So because if you are diabetic, you should see the eye doctor, because 90% of the time there is a problem with the eyes. All right. I have the prescription for eyeglasses. I don't need to see that I am diabetic, but I don't need to see the eye doctor. It's a very common perception. Majority of my patients who come to my practice, later on they get to know that there is a problem with the eyesight, but they don't want to see the eye doctor, don't want to test their eyes, and there is a problem. And then they say I use the eye drops to solve my diabetic issues within my eyes. So it's my eyes will be okay with the eye drops. That's not true. It's false. So the brother already mentioned like, our injections are more thick. Is my diabetic eye examination is covered under the BC Medical Service Plan? I knew this question will come up, but the answer is yes. It's true. Some doctors charge money, but I don't know how they handle their business. In my practice, no, I believe it's a medical connection and it should be covered. Okay. So the answer is right here. If I keep good control of my HbA1c levels, I don't need, I may not have diabetic retinopathy for at least 20 years. So 7 in 100, if we see according to that, that it shouldn't be any problem with eyes for 20 years. But it doesn't mean that we should see an eye doctor after 20 years. No, it should be seen every year. All right. These are my resources. And our professional resources. Thank you.
Thank you so much, Dr. Mohan. You gave us valuable information how diabetes affect our eyesight and our eyes, and how many of our seniors, when they go on a vacation, sometimes they spend 6 months outside and then they don't really care. But you should always look after your health even when you're on vacation or you're away for a few months. And our next speaker is Dr. Hamera Mohsin, who is a psychologist, and she has done PhD in clinical psychology and has over 28 years of experience. And she provides a 28-year experience in providing clinical therapy. She works with Fraser Health in the youth services as well, and there she will provide a very valuable information on how you can look after your mental health when you're dealing with diabetes. And sometimes we don't know. They will provide the information. Dr. Hamera Mohsin, please. Hello. Today I'll talk about how with diabetes you are supposed to look after your mental health, because sometimes it's ignored and along with diabetes, but you do face some mental health issues. But if we are aware of it and we can recognize it and see the connection, we'll talk about it. There are 3 things we should focus our talks today. One, I said earlier, mental health is very important, and it has very deep connection with it. Mental health and diabetes. I'll tell you what tips for managing the impact of diabetes on your mental health, so that we know how it's affecting mental health issues and all that. And if I know I do have issues and problems, what resources are available, and what can I do as a patient or caregiver to look after our mental health, so that our diabetes are not affecting our mental health. Not just our body, but our mind as well, because our body and mind has a deep connection. As you're looking at it, they both are equally important. Nowadays, a lot of people are talking about mental health. It's being emphasized. If you're mental health is being affected, it's going to affect your body as well. And if it is affecting your body, it will start impacting your mental health as well. When I'll talk about, when you have diabetes, then you have mental health issues that are chronic as well. It will affect your mental health as well. When you feel nervous, you feel depressed, you are worried, you're thinking everything is fine earlier, then we have these problems. Then you can have these problems and have other health problems. And both things, they go together hand in hand. First of all, half, we'll talk about it. What we talked earlier, it was all about health and your body, how you monitor it, how do you control diabetes. But I'm talking about your mental health. How can you have more information regarding that? The surveys that have been done over the years, one survey that was done only a year earlier, that was done in South Asian community, which is quite big now, especially in BC. It was a study done in diabetes. How does it affect mental health? When people were asked, then they said 43% people thought diabetes negatively impact their emotional well-being. We don't feel well, we have depression, and some people feel asthma and other problems, and it impacts. And 38% people said generally diabetes negatively impact their mental health. Then I'm not happy, I'm worried. And 67% said when people have diabetes, they feel lonely, they feel isolated, not talking to others, pulled away from others. There's so many other things people think about it. And people think, I have diabetes, I'm worried, who should I talk to? And they feel ashamed, embarrassed, and then we don't open our heart to anybody. And I'll say that sometimes depression can cause isolation and pulling away from others and not socializing with others. And I'll explain in detail about this earlier. And 76% people said they feel being judged for their diabetes. So they feel that they cannot openly talk to their siblings, their relatives, their family. So they're worried, they're always keeping it in. Whenever you have something that you don't feel right, and you have sugar, diabetes, hypertension, other problem, physical health, or you're thinking about if there's a loss, financial loss, and there's a process that you go through and different levels you go through. First of all, there's a shock. You think, what has happened? And you are not willing to admit it. You're saying it cannot happen. So you're in denial after the shock. You're not doing anything for your treatment because you're not admitting it. And then after that, there's other symptoms. People are nervous, angry. What has happened to me? Sometimes you feel about yourself, about others, or about your fate. You get angry about all these things. And that's a phase. Then it goes further than that. Next time you think, what should I do? When you go to the market and somebody tells you it's $500, you said, no, it's not $500, it's worth $300. You're bargaining. You're thinking, I don't want to take medication, even like for diabetes. People are afraid of taking medication. People don't want to take it. You're not talking to anybody, but, you're worried. But if you take it well, think about it, then you realize that I should go to the doctor, and then you realize you have diabetes, and you have this chronic problem. Then you have depression, you're feeling sad, there's a sense of loss, that's affecting your health, your mental health. You can have all those feelings, and this is a normal process. When there's something new or something big that happens to us, we go through this process. If we understand that, then we'll not just understand it. After that, after passing this stage, then people start accepting it. Then they think, yes, I have this medication, it has been diagnosed, doctor is saying that I should admit it. Once we accept something, what happens? Then you feel a little bit at peace. Then you think about moving to the treatment, taking precautions. Diabetes, we've been talking about this since this morning. You make lifestyle changes. You think, I need to change my lifestyle. I need to live my life differently so that my health can stay better. And sometimes we go back. Sometimes we go acceptance. Sometimes we have accepted it, but then we go back to depression. And sometimes people go through this process. And when people are stuck in a phase or cycle, then people are saying, there's some lacking in treatment. They're not able to understand it or fully, or they don't agree with it, or they don't admit to it. There's another thing after acceptance. Then you start taking care of your own health. You become responsible. You say, it's my responsibility. What can I do about my own health? And then you go on that journey for better health. Ministry, that's what it's saying, that take care of your health. But you are the best person to look after your own health. The doctor is going to understand one thing, provide you medication, but it will all help. But you're the one who has to take the medication. You have to take the exercise. You have to do the exercise. Mental health and physical health is equally important. And pay attention to that.
There are 3-4 things that also related to the diabetes. Those are the things linked to the diabetes. I have my notes here. There are some things we say like mental health, the psychosocial aspects of diabetes. We say and the diabetes distress. You are distressed about diabetes, that you are diabetic now. You got diabetes. In the case study, people who are diagnosed with diabetes in 18 months, 33 to 50% of people experience distress. It's called diabetes distress. So almost half of the people, they have this stress that, oh, I have diabetes. No, why I need medication? I don't know if the medication will work, or maybe it has side effects. So these kinds you have to understand. So the information will reduce your stress about diabetes. If you will ask questions to the doctors, then slowly you will try. So if there will be no answer, you will be more stressed. So to take information, use internet, so then it will be less. The stress will be less. It will not completely gone. The stress will not be completely gone, but it will be low. People who feel stress, how I will cope with diabetes all my life. This is a big illness. What I have to do? What are the things? You should have to bring a lot of changes. It will be hard in the beginning. Just keep in mind, if your car breaks down, you have to push it. First, two, 3 people are there, then they can roll it on. So then after that, even if one person push it, it will continue to go on. So it's the same thing. Once you start medication, exercise, and exchange your views, then it will be difficult, but slowly you will be able to cope with it. There are healthcare providers. There is a team of doctors. Like today we are discussing it. There are professionals. So there will be different things that will help you to cope with it. There will be sometimes problem with the relationships. So we sometimes feel isolated, alone. We don't want to talk to talk to anybody about it, like depression. So we will talk about the symptoms of depression when we go move forward. So sometimes there is a problem in the relationship. If we recognize those problems, we can solve them. Again, there are not one, two, there are 4, 5 professionals you should talk. So it's not easy task. So you have to do it. You have to admit it, but it could be done. It's not impossible. Some people deal with multidisciplinary people. There will be no complications, and then they don't have to suffer too much. There is a prevention that's possible. The third thing, people are very afraid of two things. They they have anxiety about being hyper or hypoglycemia. So the symptoms will tell you if you are hypoglycemic or hyperglycemic. There will be symptoms. So we have to there will be things that will be problematic, and we have to. But so taking information is easy with the information. Once we understand how it affects, then there will be less anxiety and the distress that's going with it. If some and person have other there is other incident trauma in the life beside this, the person is in difficult situation. If there is if you are dealing with a big trauma, other adverse experience, some has attack or something, earthquake or any other distress in life, if you were involved in that, you have some kind of trauma in the past. So any problem you have, if you are in that kind of situation and also have diabetes, then your distress level will go up. So there are psychologists, there are professionals. So then they will accept it, and how they can they will diagnose it, and then they will treat it. And physical stress that affects your body, again, tell your healthcare provider. If you feel stressed, they can ask you some questions and they will offer you treatment. Ask questions. That's why we are here, just to help you. We are here to answer your questions. People will ask you questions because it's their responsibility to understand your your issues, and then they will offer you treatments. There are 3 things. They are very common that are mental health disorders. On top of that is depression. Approximately people who have diabetes, 30% of people also experience diabetes related anxiety. Anxiety is in 14%, depression in 30%, and it's almost decently diagnosed people. When they start depression, they feel helpless. They don't enjoy life, so they go towards suicide. Their rate is higher. Remember that there are stages, as I mentioned earlier. So once you get to acceptance, then the other things go down, because the period in the beginning is more stressful, because you have to do so many things and the person feels it's no use, and so that's why the person reach to this kind of behavior. There are services you can access. So most important is you recognize them, recognize these problems, recognize these things that they are happening to you. So it's not important that these things are just because of diabetes. There are other situations, there are other mental health issues that could be present. So in your past life or trauma or circumstances in your life, so all these things going to hurt you if you have diabetes or not.
And other mental health disorders It can cause bipolar disorder, schizophrenia, and instead of type 2 diabetes. Spending money, not knowing what you're doing, and going days and nights without sleeping, unable to sleep. And earlier you were able to do, full of energy and happier. And other one is like bipolar, and there's a depression. And sometimes there's a high mood and low mood, and that's what's called bipolar. Depression I have talked about earlier. Schizophrenia also, psychosis. Sometimes people don't have connection with the reality. They think somebody wants to hurt them. Their reaction is different. Their spouse is not loyal. There's no evidence, but they feel that's how it's happening. If things like that are happening, if anything is happening out of the routine, mentally you feel different, you should approach a doctor. You should talk to them. If they are special in their specialties in that, they will. Otherwise, they will send you to a specialist. And there are other things, especially in type 2 diabetes, it's 3 times higher. If you look at another population, it's not happening. But once you have diabetes type 2, then the chances are going up. And one other thing that's very important, that the medication is given psychosis or mental health, to treat mental health issues. You think, look at the medication you're taking, if you're taking it for mental health, and what medication you're taking for diabetes. And if you have diabetes, you tell your pharmacist, and also vice versa. And how can you recognize depression? If you're feeling hopeless, helpless, lack of pleasure, you don't enjoy things that you enjoyed earlier, feeling tired most of the time, changes in sleeping patterns, you don't feel like eating, you changes in eating habits. Sometimes, it can happen due to diabetes, but it's really important to get it checked from the doctor. And having trouble making decisions, sometimes that can happen. That should check your medication, especially elderly, and ask your healthcare provider. Especially in anxiety, you feel restlessness, feeling of being tense or edge, irritable. It can also happen with the depression as well. Impatience, being easily distracted, difficulty concentrating, you are unable to focus on anything. If you're feeling those symptoms, if you're tense, and when you are really worried and unable to talk, and you're stuck, you're unable to breathe, feeling a lump in your throat and sweating, and all that can happen as well. And get your medical test done just to make sure you don't have if you have the system. And it can happen to thyroid problems, and it can happen, and you can have anxiety and depression both at the same time. And if you're high, you can feel anxiety, and if you're low, your mood is low, you can have depression-like symptoms. People look at the symptoms, and sometimes it can happen to lack of vitamin D. And mind and body go hand in hand. We want to see if it's the right diagnosis, and what's the reason for these symptoms. And of course, first of all, go see your family doctor. It's very important to have a regular family doctor, because they know you for many years, and they know your body system. You can not just walk in. The walk-in clinics doctors, they listen to one thing, give you medication, but you go to a family doctor regularly, they understand your conditions, they know what medication suits you, what doesn't, and they know your background. And also psychiatrist, if you have mental issues or problems, you can talk to them. And if you're able to comfortably talk to your GP, you can talk to them. But if they feel like that you should go to a specialist, then they can send you to see a specialist. You can go to counselor or psychologist for therapy. Psychiatrist can give you medication for treatment, and counselor or psychologist, they can talk to you in therapy, especially in CBT is the well known. There's a research done. So much research been done that the CBT can help with your diabetes and also with the depression, anxiety. And Fraser Health is it's available through Fraser Health free of charge, and they can do individual and group therapy. And these are the common symptoms. I won't go in detail because I'm out of time. I just want to say, if you're feeling disappointed, discouraged, despair, or you're feeling overwhelmed, it's too much, I'm really tired, you're feeling tired. Most important thing is to accept it. One thing is, yes, it's raining, you accept it. And if you start thinking about it and getting worried about it, then you think, oh, I don't like rain. It's always raining for me. My day is ruined. And you keep thinking about same thing over and over again. You go in that vicious cycle. So make sure you have that. Nobody enjoys diabetes, but that's for sure. But acceptance helps. And after accepting, you need to know what to do next, how to move forward with it. Right? Thank you.
Thank you so much, Dr. Hamira. You provided us very good information. So, any kind of illness, any problem, any disease, mental stress, and it could increase more. So, all the presentations are done. Now is a question answer session. I think you guys have given us many questions. So thank you so much. You are taking so much interest in this program, and you want to get more information. I have seen that people are making notes. It's very nice. We are really feeling happy about it that you are enjoying this program. So please, all the speakers come here who give their presentations in the afternoon session. Please come. There are a lot of questions.
Because we have so many questions, we'll try according to the time available to us, but we'll ask each speaker one question. We'll ask our speakers that will say, once you're done with your question, please pass on the mic to the next speaker so we can ask questions. We'll start with Dr. Chima. Dr. Chima, I have a question for you. Diabetes, arthritis, does it have any connection? There's no directly link, but both can happen. But it happens. People who has diabetes type 2, they're overweight, they're heavy. If they're 120 pounds or 250 pounds, yes, because diabetes, you have inflammation in the body and it can change into arthritis. You have higher chances of having it. The best way is, if you have any pains, if you have any age-related issues, it's different. But if you're not that old and you have diabetes and you have other symptoms, your best treatment is to control your weight, to control other things, exercises and everything else. And especially our diet, our other things that we use, spices, you should pay attention to it to make sure it doesn't not impact. But both things can happen together. Thank you, Dr. Chima. Next question is for Gurvinder.
Is there any way you can check your sugar and you don't have to pinch, like you don't have to poke, you don't have to poke the needle? Is there any method? It's a very good question. Small answer, short answer is no, but there is another option. The new meters, they go according to the sensor. The sensor has to place on the back of your arm and it remains there. What that sensor does, there is a filament of aluminum there. You don't feel it, but it is placed there for 14 days. You can use the meter or the machine to check it. But this option, the coverage is less for this option. If you have work, you are covered with your work, then you can get it.
And next question is for Dr. Preeti Suri, and a lot of questions regarding the diet, millet. They ask about sweet potato, how much you can take, mango, the quantity, how much you can eat. Please explain that. Absolutely. First of all, I want to say the first presentation, the amount, like how much penny or how much you want to eat, we talked about it earlier. Sweet potato, it's a better choice than a potato. You know, you can make a sweet potato in a recipe than regular potato. It does not raise your sugar that fast as a regular potato, and it has protein, which is and other things that are better for your eyesight. So it's a good choice for your snack as well. The amount of the fruit, it should be half cup. That's how you can check. Every fruit you can have half cup at a time. Thank you very much.
Next question is for Harvinder. So the question from the audience is there a difference if in breakfast, dinner and lunch, if I take snacks or eating one time, then 11, 11:30, 12, like small amount of food on small intervals, how it affects my sugar levels? So as Preeti told you earlier, your diet affects a lot. We have to calculate the calories. We have to there should be there should be 4 hours apart. So of course when you eat, the sugar level is gonna go up. So after 3 hours our body goes back to normal. So there should be a gaps of 4 hours. If we eat at 9 and 11, we are not giving the body enough time to get back to normal. So the timing is very important to get body to the back to normal. Secondly, well, meals are better or snack is better. So only take snacks if it's if there is a gap of 4 to 6 hours, then you can have snack. So pay attention to snack, what are you are taking. So you have to careful about the snack too. So you should have 3 meals in a day for sure. If there is a bigger gap than that, like if you need a snack, you can have it with the tea. If it's a tea time, then you can have it. But mainly, 3 main meals are important during the day.
Next question is for Dr. Mohan, or a question from the audience. If they have cataract in their eyes, can they be treated together with glaucoma? This problem is separate. First is retina is corrected by sending to retina specialist. They need to check everything. Once they say everything is fine, then we look at the cataract. There are different kinds. In rare conditions, they can do it together. Main answer is in majority of people, they do it separately. First, they correct one problem, then the other.
This question is for the psychologist, Dr. Hamera. It's very expensive to see a psychologist because can we see the psychologist free in BC if they have to go to? In Fraser Health, the services are free. You can get self referral and or you can get self referral. There are centers close to you. Gateway Station. There is one close to Gateway Station, Surrey Memorial Hospital. There are locations you can check online. The closest location you can go in person or you can call. Or they will take your intake and then they will look at your need and they will make an assessment and then which method of treatment is better for you will be given choices. There is a group therapy for depression, there is a medication for psychosis that psychiatrist will make the assessment. So all these things are free of cost in Fraser Health. In private practice, yes, it's expensive, but some people have extended benefits, they can use it for that, and it's easy to use. If you have the insurance, then it will be covered. It depends on your extended healthcare benefits. And in the diabetes centers, if you have any mental health issues, if you want counseling, we can also refer you to Fraser Health, or we can privately also tell that you need a counselor, and we can give you the number, and we can also make the referral.
Next question is for Gurvinder. In the audience, there's a question. The pen or the whatever they use, should it be new every time or they can use the same pen? A good question. A simple answer is use new needle every time, because otherwise you have higher risk of infections if they use the same needle over and over again. The needles are quite cheap. You can get it from the pharmacy. You can get 100 needles from $10-15. Every time you check it, you should use the new needle every time.
Next question is for Dr. Chima. It is regarding the medications. There are so many questions all together. Type 2 diabetes, do you need medications? If we are taking medications, only we can take metformin, or there is a shot that's done every week. First of all, if you are pre-diabetic, first of all, the definition is very important to understand the definition of pre-diabetic. Your family doctor didn't advise you. If your number is between 4 to 7 or at 5.5, you haven't gained weight, you have no issues, you can go without medication, because extra medication is not gonna help. And if you can control it with the exercise and everything, if you have type 2 diabetes, then consistently you use metformin. They will start metformin in beginnings, then gluburide and all different kind of medications. There is now fourth kind of medications. I understand. It's very important question this time. If your body built, your genetics, how your body responds to the medication. You have a lot of choices. Your doctor have choices how to manage your medication. If you are taking oral medication, and beside that you can also have injection. I'm not going to name those, so that I will be in trouble. Why you have taken our medication? Why you didn't name our medication? So some people, some countries, in our country, in Canada and BC, you follow up the code. There are 3 components: you, your family doctor, and the province. When your family doctor decide you need this kind of medication, you have to apply for that medication approved by pharmacare, and then you can take that medication. The answer is you have the choice. Take what kind of medication you want, different options. You have coverage or not. So there is a lot of methods, lot of ways to get your medication covered. It's like you cannot do this or it can't be done. It cannot be done. So Provence covers it. So then you can take the other option. Yes, look for all and every option. Thank you.
Next question is for Ravinder actually. It's regarding the medication. Insulin, Ozempic, what's the difference between those? What are the side effects of those? Insulin that we have, Ozempic injection, it's an injection. In your body, you have a hormone that's called which one? It keeps your stomach full or helps insulin and build the insulin directly and control it. That hormone, it's in our body for a short period of time. Because of diabetes, that hormone goes down. Ozempic insulin, it's the same hormone that goes in directly. It works long term. Then that's why you need it just once a week. Insulin, how's that different? Insulin is created directly from the pancreas. It's for the injection, it's a totally different thing. And it brings your sugar level lower. Ozempic, it helps more sugar build and also control your levels. And the side effects. The side effects, insulin, there's only one, that you can gain weight. The reason is when the sugar was not being used earlier, but with insulin, you're using that sugar, it's getting consumed right, and that can increase your weight. Ozempic, you feel nausea, or sometimes you feel constipation, or my patients, they talk about GI side effects, nausea. And that's why we said take this at night, this injection at night, so nausea can be settled. If nausea is not settled, it's been a week, 2 weeks, it hasn't settled yet, then talk to your doctor. Then you can start with the lower dose. Then lower dose, if you are able to handle it, then you can increase it.
The next question is for Preeti, if you can answer. How alcohol affects cholesterol, sugar, and blood pressure. There are varieties of sugar and salt. Which one should be used or which one shouldn't be used? All kind of sugar, honey, cane sugar, jaggery, all sugars are sugars. They're right. Honey is good, just pour honey. It wouldn't affect your blood sugar. All sugars are sugars. It's same effect. Salt, pink salt, Himalayan salt, rock salt, salt is salt. Same amount of sodium. There are some, there is more mineral content, but it will still affect your blood pressure. There is a product, is potassium salt in the market. People who have diabetes, people have problem with kidney, so they can talk to their dietitian, and then they can use that kind of salt. That will. Now we talk about alcohol. I don't know the reason. What's the motivation to consume alcohol? So I don't understand. So how it affects blood pressure and sugar? There are normally sugar in most of the alcohol drinks. It can raise your blood sugar. So when we consume alcohol, there are snacks with it. So they will raise your blood sugar. So it depends what choice you make. So when you consume alcohol, and your routine for eating meal is disturbed, that also will affect your blood sugar. If the alcohol consumption is out of control, so people get high on that. That can worse affect uh, blood sugar will be up, and then you won't be able to recognize your symptoms, so you cannot be asked for the medication, you won't be able to. So alcohol consumption is affects the management of diabetes. And same thing with heart disease and other things. There are some medications and they have contradiction with alcohol, so it's not advisable.
Next question is for Dr. Hamira. What is CBT and what are the resources available to make it normal? CBT is a therapy. It's your cognitive thinking therapy. When people think, oh my God, I got diabetes, what I'm going to do? I'll be dead tomorrow, or, then you start worrying about it a lot. And it's normal. Everybody goes through that. Whenever there's something new, it comes to your head. When you have those thoughts, though they bother you, they make you depressed, you are feeling a sense of loss, that something is gone. We are unable to walk. There's some sort of problem, arthritis, and some things are omitted from your life. It's normal, but it goes beyond the level. Then you say, okay, I have depression. So CBT is a way of changing your thinking. And first you go to acceptance, and then how do you change and live your life happily and have a better quality of life? And what's the purpose behind it? What's your life under circumstances? What can be done now? What can I do now? There are so many choices, and need to change the thoughts. After changing thinking, changing your behavior, you're not meeting others, you're not socializing. How do you move away from that and increase your motivation? Think better, self-management. How do you find solutions and find solutions? And how we can talk to others, seek advice. So all those kind of things, solutions, you look at it, and then you think about it, and how do you change it? You are already doing some of those things earlier, but you forgot that you used to do it, but now you can do it again with the different ways. How do you address it? And when you change your thinking, you change your behavior, and you will see how your mood is improving, how your mental health is improving. So CBT it's based on your thinking, your thoughts, and
the last question of today is for Dr. Moon. If we if we are not able to answer your question, then there will be another workshop. Then we will try to answer all your questions. Today we want to give opportunity to every speaker so that they can answer your question. Don't worry about it. We will answer everything. So Dr. Moon, the question for you, and there are two questions. Where is your clinic? And the second is there any such eye drops where the eyesight we can slow down the progression? First, I'll answer the second question. It depends on the condition. What kind of problem? What kind of drops? Why you are putting drops? As I talked, there are sometimes we can do laser or medication for the cataracts. But if there is more problem, then more medication is needed. Generally speaking, that my eyes are itchy, and then we gave artificial tears and medications like that. So first see your eye doctor, and then they will assess what kind of medication is needed. My clinic is on Newton 128 and 76. If you need the card, you can ask me. Thank you so much. Thank you everyone, all the speakers providing us very good information. So the experts gave all kind of good information. So it's your duty now to fill in the survey. Thank you very much, everyone. There is a survey in your bag. Please fill in the survey so that if we make a program like this, if we arrange a program like this, they can make improvements. If you give us instructions, we can make more improvements accordingly. People who are seeing it, watching it online, please scan your QR code on your and please complete the survey. And people who heard this, people who has headsets, please before leaving return the headsets. And beside that, I all the media partners who came here by listening to them, we are very thankful to them. Asian Star, Connect 91.5, Drashti Magazine, Harpreet Singh Show, Indo-Canadian Times, Indo-Canadian Voice, Joy TV, Link Newspaper, Radio India, Red FM, Omni TV, Sanja TV, Shere Punjab, Spice Radio, Zoomer Media. So thank you.
Please don't leave yet. And there's some good stuff coming to you from City of Surrey. And they will come and approach the winner. About beyond that, I wish to thank community partners who has done a wonderful job repeating this information over again. One is Choose to Move, Acting Aging Society, Family Caregivers of BC, Jim Pattison Outpatient Surgical Center, Lakshmi Narayan Mandir, Vedic Hindu Culture Society, Translink, Vancouver Division of Family Practice. Dr. Chima, about the Ministry of Health. First of all, we need to thank really, as I said earlier, we are at a really good place when governments are providing this information in our language and they are approaching us to look after our own health. We've done all for us. BC Health Ministry, they have provided funding for this, and ICON has provided this initiative. I wish to thank you and who has provided this information in our language and provided this very informational program here today, and hope there will be more programs like this. And for special thanks to our speakers, that this program was not possible without their input and their speeches, that they give us practical information who understand our culture, the language. Harvinder Gill, Dr. Guljar Chima, Dr. Jigir Pada, Harleen Chauhan, Preeti Suri, Gurinder Gill, Dr. Mohan, and Dr. Hamera. Thank you so much. Thank you very much for the information, wonderful information. And we should clap for all of them, big hand. And especially the health exhibitors we have out there. City of Surrey, a special thanks to City of Surrey. We really appreciate that. We definitely need to appreciate them. They give us the space, give time, booth is outside. Diversity, Fraser Health Virtual, Guru Nanak's Free Kitchen, Options, Pain BC PICS, South Asian Health Institute, Surrey North Delta Region of Family Practice, University of Victoria, Self-Manager BC. Thank you very much. Thank you very much. And a special thanks to our translators who've been doing this for Panjabi to English, English to Punjabi, for people who've been sitting at home, Navdeep Atwal and Pradeep Mayas. Thank you very much to them. And Dr. Chima, thank you very much. And you should say something for ICON as well. Turn it on, please. First of all, I just want to thank everybody for coming here. It takes a lot of time and effort. and all these discussions we had. It takes a lot of time. It took us 3 months to do all that. About the organization, Joanne is main head of that is organization. She's here. She has done an exceptionally good job, and Herlene Chahan, and Gurleen Chimna, Nika, and Mary. I'm so grateful that this team has worked so hard. I don't have much time, but they talk to me on a regular basis, and we developed this wonderful program. And Dr. Kendall is out, and Dr. UBC, Department of Medicine, Digital Medicine, and I'm really thankful to all of them. Prabjot Kalon as well. And I was telling her that we are unable to pick the right words. After 15, 20 things, we forget all that. And she's done a wonderful job. Give her a big hand. And after saying that, we'll talk again if there's time. I'm so grateful that you all came here, and especially City of Surrey. Thank you very much, and all my colleagues, my team, and management team, and who are present there. And we are so grateful they took their time on Sunday, being here and being very respectful. Thank you. I just want to say thank you very much.
Most exciting part of this day today, there will be a draw. City of Surrey is so everybody stand on this side after the draw, and we will give prize. Some people don't have the tickets. People who have tickets, I think there will be a draw. I don't know where the tickets came from. There are small prizes, nothing big. So the biggest thing beside the prize is that 200 people attended, 2 people are here, and there are people who joined us online. Thank you so much, everyone. If you have tickets, I'll call the numbers.
You can stay here. Please stay there. The name is Usha Rao. Usha Rao. Very good. We'll get the bag to you. And the number is 019 4299 019 4299. If not here, then I can go to the next ticket. Next name is Green. Next one is number again 0194351. 0194351. Some people are looking at tickets 0194351. Kim Chauhan. 019 4372 019 4372. Let's see. Unable to read the name. I think it's Glady. Glady. Next, Shinu Singh. Shinu Singh. Okay. And two more. And their two common numbers. 0194345 0194295. Nobody. Next. 0194320 0194320. Nobody. Last ticket we should try. Surjit Jaswal. Okay. No, thank you so much for all of you coming. And again, anytime there's a function like that, most important, we forgot all the volunteers. Thank you very much. All of you have been very helpful. The first year medical student who came to attend this program. Thank you for your participation. Thank you.